chair.
Yeah.
Yeah. Y'all look nice tonight. I like that scarf. Hey.
Thank you. Thank you.
Hiding that neck. What did Marcos do?
Yes. I did my neck.
Nice, nice. Where's everyone at? Let's see here.
Oh, they got 2 minutes.
Okay, got it, got it. How's campaigning going, ladies? That good, huh?
Forever
I know.
campaigning.
My condolences to all of you.
I'd forgotten how hard it was.
Oh, the weather was beautiful today, so I'm hoping it gets. I hope it cools down pretty significantly here.
Yeah, that would be nice, wouldn't it?
Yeah. So.
Yeah.
I actually pulled out my
I've been
sweater.
doing this since July. It's freezing out there now. I love it. It was 105 degrees. It was like the worst.
Yeah. Yeah. Hey, D.
Hey, Sam. How's everybody?
Hi, Dee. How are you?
Doing good. Doing good.
I'm gonna try to do this from home today.
You're just as busy as everyone else these days.
Yeah, it's been a little hectic.
Dee, what are those photos behind you? Who are those boys?
Those are my sons 30 years ago.
And the middle one's the two of them together. I was like,
And they were sweet and kind.
Back then.
Right, and then they grow up.
Yeah, the oldest is now, I guess, 41, and the youngest is 39, or almost 41. Yeah.
Okay.
Or he's gonna be 42. No, the oldest is gonna be 42, December.
And how's the grandbaby in Florida?
Oh, well, he's due to be born in first part of November.
Oh, he hasn't been born
Oh,
yet.
wow.
Good luck to them.
So,
Congratulations. That's
thanks.
great.
Thanks. Laura, tell us when we're good to go.
Okay, Mayor. We're just waiting on a couple of people.
All right. Y'all know, call 258-4874 when you need if you want to speak.
Yes, sir.
Rep Salcido is having a couple of issues here. We're going to try and get them resolved.
Hello?
Hi,
Hello?
Rep Salcido. Can you hear us?
My devices aren't working again.
Oh, Rep Rodriguez.
Yeah, so I'm talking to you on my phone. Neither my tablet nor my computer are connecting.
Okay. We'll get you some assistance.
Alex, I like your hair up like that.
Laura Prine, can you please let the reps know that IT is working on it? They've just messaged, and if they can't see, I don't know if they can connect and see the message, but IT will be in touch shortly with her to get that sorted.
Okay. Did you all hear that? IT is working on getting the issues resolved for Rep Rodriguez and Rep Salcido. Rep Salcido is in, but she says she has no video.
Laura, this is Carla. I'm on my phone Teams app because my computer won't let me log into the Teams app on my laptop.
Okay.
Have we got a quorum, Laura?
I see currently on the screen, I see Reps Lizarraga, Anello, Morgan, Rep Hernandez was on there a minute ago. Let me see if we can get her.
She's back.
She's back.
I'm on my phone. Both computers keep logging me out.
Yep.
Okay, I do see a quorum on the screen now.
Okay, let's begin.
I'm just gonna, okay. Good afternoon. This is a special meeting of the El Paso City Council for Monday, September 28th, 2020. It is 3:35 p.m. Due to the ongoing pandemic, we continue with video conference, teleconference formats for these meetings in order to avoid congregate settings in chambers. On the agenda this afternoon is the agenda review for the regular City Council meeting of September 29th, 2020. And at the conclusion of this meeting, we will be convening a council work session. So Mayor Margot is present and presiding, and we begin with roll call. Mayor Pro Tem Shoresbein has requested to be excused this afternoon. Representative Anello?
Present.
Hernandez?
Here.
Morgan?
Here.
Salcido?
Present.
Rodriguez?
Here.
Rivera? Lizarraga?
Present.
Mayor, we do have a quorum.
Okay, let's begin. 3.1.
Yes, good afternoon, Council. Eddie Garcia with Economic Development. Item 3.1 is a request to approve a resolution that allows the mayor to sign an interlocal and partnership agreement with Workforce Solutions Waterflex. The county judges from El Paso, Brewster, Culberson, Hudspeth, Davis, and Presidio will also be signing this agreement. The interlocal and partnership agreement establishes the Workforce Development Board, which consists of the chief elected officials for the aforementioned counties and the mayor, and for the mayor of the city of El Paso. The agreement also lays out the operations and responsibilities for the various chief elected officials. And with that, Council, I'll take any questions.
Is this changed from any previous agreements?
No, sir. They just combined the interlocal and partnership agreement into one agreement, sir. So it hasn't changed at all.
Okay. Let's go to 4.1.
Good afternoon. 4.1, 4.2, and 4.3 are authorizations to sign an interlocal agreement between ESD 1, 2, and Isleta del Sur Curve. This is for a grant received from the Assistance to Firefighters grant, and this will be for the rehab vehicle that all the departments will be able to utilize.
Okay. All right. 5.1.
Good afternoon, Yvette Hernandez. 5.1 and 5.2 are requesting authorization to sign a support for two projects, the PDN Trail McGoffin shared use and the Playa Dream shared use. And these are competing against local MPO entities for local funds for the TASA funding.
Okay. 5.3.
Sorry, 5.3 is me as well. 5.3 is a letter of support for Amtrak. It is requesting the delegation to request additional appropriations and or to request that Amtrak does not cut services.
Just want to maintain their same scheduling, as I recall. I was asked to sign previously.
Yes, sir.
Okay, 6.1.
Good afternoon, Mayor and Council. Ben Fife with Parks and Recreation. Item 6.1 is request for a facility use agreement with El Pasoans Fighting Hunger to be able to provide food distribution from the Nolan Richardson Recreation Center. The organization recently lost access to their Northeast site, and so this will actually fill a very critical need in Districts 2 and 4.
Yeah, I was out there last week. It is critical, and I think I was out there Wednesday or Thursday of last week, and they're serving 138,000 El Pasoans every day. So.
Yeah, Ben, this was great. I mean, we've seen the lines on Saturday at the Wells Fargo have just been out of control, and I think it's great that we're putting this one back in for the community. Thank you.
Yeah, just remember we got 138,000 El Pasoans being served daily. That's how bad this pandemic has been. Okay, we got the appointments, tax refunds, campaign contributions. We're going to have some presentations. Okay, the ordinances, let's go to 13.1.
Yes, good afternoon. Raul Garcia, Planning Inspections. 13.1 is the first reading of an ordinance rezoning property to AO Apartment Office. This is for property at 11371 Ardell. There is considerable opposition on this case. We did receive one petition with 19 signatures, 4 emails, and 5 letters in opposition of this request. However, this is not a 211 case, and the City Plan Commission recommended approval on a 4-2 vote.
Okay. 13.2.
13.2, sir, is going to be deleted. We did receive a request from the property owner to withdraw this case, so this item will be deleted per the applicant's request.
Okay, 14.1.
Good afternoon, Paula Salas with Purchasing and Strategic Sourcing. The strategic goal for this item is number 2. Set a standard for a safe and secure city. The linkage to the strategic plan is subsection 2.1. Maintain standing as one of the nation's top safe cities. This is an annual renewal for certifications for the El Paso Fire Department uniform personnel. This is a sole source procurement. We recommend issuing purchase order to the Texas Commission on Fire Protection for an annual renewal for certifications for the El Paso Fire Department uniform personnel.
Since they're really in a presentation, this is an annual event. Is there any reason this shouldn't be on the consent agenda?
Usually any sole sources or anything over 50,000, we put it on regular, sir.
Okay, if it needs to be there, fine.
Mayor, that was at the request of council that all sole sources be placed on regular agenda. Is not required by the state statute. So if you want to move it back to based upon the dollar amount, we can.
Well, we're not going to get to it today right now, so I'll go ahead and leave it where it is. Okay. 15.1.
Hi, good afternoon. This is Amy Olivas with Purchasing and Strategic Sourcing Department. And I apologize, I'm also on my phone because the Teams is logging me out as well. But items 15.1 through 15.6 are all related. They fall under strategic goal number 6, set the standard for sound governance and fiscal management. The linkage to the strategic plan is subsection 6.8, support transparent and inclusive government. The execution of these memorandums of understanding will support the delivery of technical assistance and resources to businesses within our ecosystem. So all of these MOUs are with El Paso Chamber, the Hispanic Chamber, EPCC Small Business Development Center, EPCC Contract Opportunity Center, Southwest Minority Development Council, and the United States Small Business Administration. Thank you.
Okay. Yeah, I thought they all should be together. So tomorrow, council, why don't we take 15.1 to 15.6 with one motion? Is that okay? All right, 16.1.
Good afternoon. Tasha Kale with Purchasing and Strategic Sourcing Department. The strategic goal for this item is number 8, nurture and promote a healthy, sustainable community. The items dedicated to the strategic plan goal is subsection 8.6, provide long-term, cost-effective, sustainable regional solid waste solution. This contract will be used for refurbishing the CAT 836 compactor being used at the landfill. This is a new contract being recommended for award pursuant to the captive replacement parts or components for equipment exemption 252.022 of the Texas Local Government Code. We are recommending the award of the contract to Wagner Equipment Company, DBA Wagner Power System, Wagner Rents Inc., Second Steel Used Parts, Cytec Technology for the rebuilding of a CAT 836 compactor the city purchased in 2008.
Okay. 17.1.
Good afternoon, Mayor and Council, and Guyante Planning and Inspections. Item 17.1 is an ordinance granting a special permit for 1022 Chickadee. The proposed use is a duplex, no opposition at CPC, and approval was unanimous.
This is, we postponed this from the last one, and I still think Chickadee ought to be changed to Chick-fil-A and ask for dollars. But we'll talk about that.
We can certainly run it past them.
What's that?
We can certainly run it past them.
I think that'd be a good idea.
Get some money.
Little Chick-fil-A versus Chickadee. Okay. 17.2.
17.2 is an ordinance that would rezone the property at 6391 Domingo. Proposed use is duplexes. CPC approval was unanimous, no opposition.
Okay. 17.3.
17.3 is an ordinance that would grant a rezoning of the property located at 2300 McKinley 2300. This is to provide additional parking for an existing nursing home. CPC approval was unanimous, no opposition.
Okay. 17.4.
17.4, this is Ellen Smythe, Environmental Services. This is for an ordinance granting to Paul Berube a non-exclusive franchise for the waste container trash can ads.
Okay.
Mayor, I have a question.
Representative Hernandez?
Will the second reading of ordinances, are they all voted individually, or we vote for them separately?
They're individual.
Individual votes? Okay, thank you. That was it.
17.5?
Yes, sir. 17.5 is the second reading of an ordinance vacating a 20-foot drainage easement. There are no adverse comments from any departments. CPC recommended unanimous approval.
Okay. 18.1, we already know what that is. We can talk about that tomorrow. That's the Juneteenth, right?
Yes, sir.
Okay. 19.1.
Good afternoon, Elizabeth Triggs with Economic and International Development. 19.1 is a resolution authorizing the mayor to sign an interlocal agreement between the city and the Downtown Management District to partner on the delivery of various services and programs for the benefit of downtown businesses, residents, and visitors. The services and programs which we propose partnering on include supplemental sanitation services, special event permitting, wayfinding kiosk and street banner content management, the commercial facade grant program, bike rack accessibility, business recruitment, retention, and expansion, and other public outreach and marketing services on an as-needed basis. The city and the DMD have historically partnered together on all of these programs, many of them since 2011. The current interlocal agreement expires at the end of this month, and the proposed interlocal continues our partnership to achieve the mutually desirable outcomes and provide for effective and efficient service delivery in downtown El Paso.
Is there going to be a presentation tomorrow on this?
Yes, sir, there will be.
Okay. 20.1.
20.1 is the authorization to sign a advance funding agreement, and this is for the reconstruction of Rojas widening. This will be widening from 4 to 6 lanes from Joe Battle to Bill Burnett on Rojas Drive.
Okay. 20.2.
Good afternoon, Lisa Gallo with CID. This is for a discussion item on 200 North Kansas for action to acquire and close on the property. We will be using the property with Federal CARES Act money for COVID Education Task Force, contract tracing, and our COVID call center operations.
Okay. 21.1, going to vote. We're going to have a discussion on 21.2. 21.3 is Enrique. 21.4, Charles Ponzio, and the Compassion 2020. Okay, we'll have those tomorrow.
Yes, Mayor, and Mayor Pro Tem Schwarzbein requested that 21.5 be moved to the forefront of the agenda with the revisions tomorrow.
That's fine. Okay. Okay, we can adjourn this one and move to the work session.
May we have a motion to adjourn?
So moved.
Second.
There's a motion and a second to adjourn the agenda review meeting. All in favor?
Aye.
Aye.
Anyone opposed? And the agenda review meeting for Monday, September 28th, 2020 is adjourned at 3:49 p.m. Mayor, would you like to move to the work session?
Yes.
Okay. Good afternoon. This is a work session of the El Paso City Council for Monday, September 28th, 2020. It is 3:50 p.m. Due to the pandemic, we continue with video conference and telephonic formats for these meetings to avoid congregate settings inside chambers. Mayor Margot is present and presiding. We begin the meeting with roll call. Mayor Pro Tem Schwarzbein has requested to be excused this afternoon. Representative Anello.
Aye.
Hernandez.
Aye, present.
Here.
Morgan.
Here.
Salcido.
Present.
Rodriguez.
Here.
Rivera.
Present.
Lizarraga.
Present.
We do have a quorum. The first item on the agenda is a notation of the August 24th, 2020 Financial Oversight and Audit Committee meeting.
Yes, this is Edmundo Calderon, Chief Internal Auditor for the city. Just wanted to report out to the City Council that the Financial Oversight and Audit Committee met on August 24th. We discussed the following: discussion and action on the update to the City of El Paso's investment policy. We had discussion action regarding the update to the City of El Paso's debt service policy. We discussed the second quarter update to the audit plan. Fourth, we discussed the third quarter update to the audit plan. And then the last thing we did with the fifth item was discuss our surveys to audits that we do. So that concludes our update to the City Council. I'll answer any questions if anybody has anything.
I don't hear any questions. Thank you.
You're very welcome.
Thank you.
Bye-bye.
Number 2.
Item number 2 is presentation and discussion by the COVID-19 Response and Recovery Cross-Functional Team, providing information on key activities, efforts, and processes. And we begin the presentation with an overview from our City Manager, Mr. Tommy Gonzalez.
Good afternoon, Mayor, City Council. I'm going to start with some good news on our update and the overview for what we're going to present today as a team. And the El Paso Strong COVID-19 website was awarded the nationwide top honors for overall winner. And what it really points to is the fact that the award program is designed to recognize the achievements and overall best practices of government agencies that have gone to the web and beyond to radically improve the experience of government and push the boundaries of how services are delivered. So this award is for best practices and also for new innovations, and we got the best in the country. So I think that speaks highly for the team that we put in place, the council and the mayor's direction with regard to how you challenge us to put more information out there. It's something that we want to make sure that we're giving the best when it matters the most to our community. And I think this demonstrates that we put out as much information the best way possible, and it got recognized nationally. The 2020 Future Ready Award also looks at different public sector innovations And so again, this speaks to the team and the work that's been done. We made a good deal of progress.
He's frozen.
Yeah,
City manager.
Tommy, you're frozen. We can't hear you.
Mayor, I recommend we go ahead and proceed, and we can catch Tommy.
I'm back.
Oh, you're back?
I'm back on.
Okay.
I'm back on. Okay, so we've seen after Labor Day 75% increase in positive cases. The positive rate has increased. Obviously, hospitalizations increased 32%. Again, all of this has been since Labor Day. Current trend across the state and other parts of the U.S. is similar. Testing rate is up 23%. We've got a commitment also from the state to remain in place till the end of October. Again, they only make commitments out a month in advance. The fact that we've got them, the mayor and the team has gotten them to get 2 months out, I think that speaks to the relationship that we have with the state and the way we've pushed that the testing to be in place as long as possible. So we're going to continue to ask them to remain in place for as long as they can. Total tests performed, we're almost at 285,000. Total positive case, we're a little bit under 24,000. The positivity rate is 7.04, and the current 7-day rolling average is 8.39. The recovery rate is at 82.4%. The asymptomatic cases, there's still 1 in 4 positive cases that are asymptomatic. So it's very important that we continue to wear the mask and do the social distancing. There's a lot of people walking among us that have it and are not showing any symptoms. So that's very important that we remain vigilant in that respect. So more than 95% of the deceased have underlying health conditions. And therefore, we pushed the Live Active El Paso website. We've pushed that whole idea of getting in shape. I know that I just spoke to one of our team members who lost a family member who had a lot of those underlying health conditions that could have been prevented. Obviously, you can't get in shape overnight, but the more we can do to push the idea of remaining as healthy as possible, that not only can it help you with the pandemic, but with the flu, as we pointed out. Right now, we've tested. We've given vaccines to as many people as we did all of last year for the flu, which that's great news. So we're continuing to push that. We've had a big push community-wide. So we want to thank all of our partners that have helped us with that. We want to thank you for pushing that out through your websites and through your email distribution list that you have. So thank you for that. So the wellness partnerships with the ISDs continue to address COVID-19 and influenza prevention. So we're teaming up with the ISDs to push out flu shots as well. Again, the current average daily testing rate is under 2,000 at 1,885, although we did see that increase. We again want to encourage everyone to get tested. The economic response and recovery, what we have to update you there is that the rebuilding has focused on the cash flow and liquidity, on our strategies, restart and continue operations, and invigorating demand for the business. We have 11 community partners, 17 programs, 19.4 million in assistance, and the emphasis has been on safety and education. And that really has worked in terms of getting the information out and helping businesses open up safely and properly. A lot of them have done the Pledge to Safety program that they have done with the Economic Development Department, and it's just really helped them educate not only their workers and their team, but also their customer. So again, we want to continue to be proactive and keep fighting these trends. I mean, every time we have a major holiday, there seems to be an upward trend whenever that happens. So it's important right now for everyone to get tested and also get your flu shot. And we want to make sure that if there's information that people need, they go to the El Paso Strong website. It's got all the information there about asymptomatic cases, about staying home, social distancing, wearing a mask, good hygiene, again, being active and living an active life in order to fight off those underlying health conditions should you contract the virus. So that concludes my portion of the summary. Again, I want to thank the team for a job well done on being recognized nationally, on making sure that our community gets the information they need the most when it's the most critical. Turn it over to Carla Neiman, our city attorney.
Good afternoon, Mayor and Council. I'm Carla Neiman for the record. If you'll bear with me because I'm working across 2 devices to get this information to you. We have a few updates for you all. As you all will remember, Governor Abbott issued updated disaster declarations a few weeks ago. We anticipate that he will be updating and extending the statewide disaster declaration next week. The last issuance was on September 7th. On September 17th, he issued 2 executive orders, which is GA 30, which further reopened the state, and GA 31, which pertains to hospital operations. As you all know, GA 29, which mandates face coverings, is still in effect, except where there are specific situations where you're not required to wear a face mask. And then finally, the mayor issued a 5th local emergency directive on September 18th as a result of the amendments through the governor's office of GA 30 and GA 31. The next item is the emergency ordinances. Later on in today's meeting, council will be again considering the 3 current emergency ordinances. As you all know, we are required by charter to have the members of council vote unanimously with the consent of the mayor. And then those emergency ordinances are automatically repealed on the 31st day. Unless the emergency still exists, council will doesn't have to reenact it. We continue to anticipate that we will need these 3 ordinances reenacted through October 28th. And then finally, these are the orders of the emergency ordinances, but the first one at the top is the longest standing ordinance, which was the declaration of the disaster. And then the second one was instituting the emergency measures. And then finally, the most recent one that council adopted at the end of August was for the use of the right-of-way by our restaurants and businesses. And then finally, we have our an update on the judicial matters. We are continuing to see a delay in our jury trials, both in the civil and the criminal context. As you all know, those are taking effect at the Texas Supreme Court level and are coming down at the local level. We are not having municipal court until later on in January, although we are currently scheduled, but we don't anticipate being able to hold those trials because the defense attorneys are asking for continuances. And then most recently, last week, our local U.S. Western District judge notified us that all civil and criminal trials through October 31st will be reset by each of the presiding judges. And then for the city of El Paso, we currently have about 150 cases in active litigation. All of those cases have been impacted one way or another, either because of the delay in the trial setting or delays in being able to have hearings or being able to conduct discovery through oral depositions or in writing. Those continue to be reset as necessary. And then finally, on Friday, Governor Abbott announced that over $171 million of CARES funding would go towards the creation of an eviction diversion program, which is intended to assist renters in their homes and staying in their home and catch up on rental payments. This is in hopes that it will significantly help courts, which are expecting a large number of eviction filings. There will be $4.2 million that will also be earmarked for the Texas Supreme Court to help the state's legal aid and pro bono lawyers in assisting Texans with help with basic legal services during the pandemic. And then finally, on the HR support, as you all know, there has been a vast number of changes in federal law as a result of the CARES Act. And as a result of COVID on our employees, we would continue to navigate that world, and we've continued to provide advice on, obviously, the payroll tax deferral. and we're continuing to keep up with updates under the Department of Labor and the Family First for Coronavirus Assistance. And then we also have changes happening at the EEOC level as the pandemic progresses, either through executive order or administrative changes at the different agencies. And then there are some cases that are being filed at the federal level through the Department of Labor that is litigating the Coronavirus Relief Act monies and the way that those orders are being implemented. That concludes our presentation. I'll turn it over to Chief D'Agostino. Thank you.
Chief, if you're on, you're muted.
Or if you want, I can continue with the presentation. I was having trouble logging in through Teams, and I'm in my phone.
Yes, sir, because the chief got kicked out. He's trying to get back in. You can go now, Dr. O. Thank you.
Well, good afternoon. I'm trying to log in, and I was having a little bit of trouble. If we can get the next slide, please. Well, we continue to see an increase after Labor Day weekend. We started seeing about approximately 10 days after steady increase in the positive cases, which has continued up to now that we see that is dropping very slightly. And we're hoping that that is going to be the new trend where it's going to be stabilizing and going down. We saw up to last week a 75% increase in the positive cases. And we normally see that increase in the cases after a holiday. We saw it with Mother's Day, we saw it with Memorial Day, and now we are seeing it with Labor Day. The positive thing is that we saw an increase in the testing, which is going to give us a better idea who is infected. We've been encouraging people, if they went out of town, if they were having some gatherings, or if they felt that they were exposed, please come and get tested. The doubling rate for the positive cases continued to increase, but at a slower rate, and that also is promising. And our infectivity rate is still a little bit above 1. That is also a positive thing, and we're hoping that it will drop as we see that the number of positive cases continue to decline. The cases continue to be more than 200 tests. The testing, more than 200 tests per 100,000, and our recoveries are close to 83%. Our asymptomatic rate is about 1 in every 4, which is about 25%, as we heard from Mr. Tommy Gonzalez. And our hospitalizations, we're monitoring the percentage of people hospitalized with COVID, and it was about 11% last week. Today it was 12%, and we try to be below 15% as stated as a threshold by the governor. The case fatality rate is hovering about 2% and has been stable for several weeks already. More than 95% of the people that have passed away in our community continue to be having underlying conditions, and among the most common ones are high blood pressure and diabetes. So we continue to encourage everybody in our community who has pre-existing medical conditions to go visit your primary care provider, get checked, get those conditions under control, and have enough of the medication available for you so you can continue treating those conditions, keeping them under control, so you wouldn't be another cause of complications if, unfortunately, they get infected with the COVID-19. We continue to push very hard for everybody in our community to get immunized against influenza, because influenza and other respiratory viruses, they share the same symptoms, and we see a very sharp increase in hospitalizations, ICU utilization, and ventilators because of respiratory conditions such as influenza. Normally in El Paso, our influenza season starts in October. It peaks at the end of December, beginning of January, and then it starts slowing down by spring break. So we want to make sure that everybody gets immunized throughout the month of October, so they will be ready and prepared to face the influenza virus in case they get exposed to that. We continue to encourage people to follow the preventive measures that we have already established for COVID-19, which is the wearing of the face mask. I'm sorry.
Next slide, please, IT. Next slide. So Mayor and Council, we just wanted to continue to provide you with some updates in terms of the linkages to the original COVID United Task Force updates. In this presentation today, you will not only hear from the task force in terms of the final recommendations for midterm and long term, but we'll continue to provide you with updates on the testing and other recommendations that were included in the short-term recommendations on slide 55 to 60 with Ms. Tracy Jerome discussing testing and partnerships, as well as our hiring plan on slide 72 with our interim health HR director, Ms. Lujan. So I'm going to turn it over to the task force to go over the final recommendations. Moving forward, you will see an integrated plan of not only the short-term recommendations, but the entire plan that is included that you'll be seeing in a few slides. And over to Dr. O and Patel for the presentation. Thank you.
Thank you very much, Ms. Mack. If we could have the next slide, please. Next slide, please. Very good. So we're going to be giving a short presentation on the mid and long-term recommendations, which we were able to finalize, and we're putting everything in the document that is going to be turned over to all policymakers, elected officials for your review. As part of the El Paso United COVID-19 Transition Task Force, we invested a lot of time, effort, and we're very happy with the recommendations that we are putting in our document. Next slide, please. On the recommendations, we divided into four main categories. One is going to be the preparedness. The next one is going to be the data. The next one is testing and contact tracing. And finally, the communication part. Next slide, please. And with that, I'm going to be handing it over to Dr. Brandon, who's going to explain the different points on all those four big categories that constitute the mid and long-term recommendations.
Great. Thank you, Dr. Owen. Can you hear me okay?
Yes.
Yes, ma'am. Yes, we can hear you.
Thank you. All right, great. Thank you, Mayor, for having me back. Today I'm going to go over, as Dr. Owen was saying, we're going to talk about the mid and long-term recommendations that were developed. Previously, we went through the short-term recommendations, so a lot of those are linked to the mid and long term. So I'll try and let you know when there are those linkages and sort of the continuation of the thought process behind the short term and what we're thinking as we suggest that they move into mid and long term visions as well. If you'll recall, there were two overarching recommendations. The first to create the scorecard, which has been done and brilliantly implemented. And then the second was to implement recommendations in a regional cross-sector, public-private collaborative way using available resources. And I think you'll see that overarching recommendation embedded into a lot of the mid and long term as well. Lots of recommendation and sort of a theme about utilizing community resources and coming together as a community to address this issue. Next slide. So we started off with 18 short-term recommendations and went and added 10 more for the mid and long term to come up with 28 recommendations. And I'm just going to work through them here now. Dr. O, please feel free to jump in as you like to make additions along the way. Next slide. The first thing, mid and long-term recommendation focuses on preparedness. And this, if you'll recall, the very first short-term recommendation was to advise on the development and dissemination of school reopening and sustainment plans. And this is a continuation of that recommendation. So continue to act as a resource for schools as they develop, implement, and revise their COVID health and safety plans. The task force just felt, after talking to schools and school administrators, that this was going to be an ongoing challenge for schools and that they would be relying heavily on the public health team and on the city to advise them along the way. So simply just a recommendation to continue with those efforts as we move forward.
And as a comment, we have been able to meet with the schools on a regular basis. We continue to provide support and guidance, and we're working as partners as we have been doing even before the COVID-19 pandemic. It is uncertain times, and as such, we want to provide that security and that expertise to the school districts so they can make the proper decisions between the superintendent, the school boards, as mandated by the governor and the attorney general.
And next slide. The next recommendation is also for preparedness, and the short-term recommendation here was to initiate a process to develop a model and strategic plan. And this continues along those lines. Oh, sorry, I think we missed one. Recommendation number 6. So recommendation number 6 is to develop a model for public health organization and strategic plan for future public health emergencies. So just that continuation of beginning the strategic plan and continuing to see it through. And again, the task force recognizes that while we can put a time frame on the mid and long term, that COVID is going to happen in its own time frame, and some of these might need a longer amount of time to fully develop and implement. Now we can go to recommendation number 7, unless Dr. O, you had anything you wanted to add to this one, or Dion.
Let's continue.
Great. Okay. So recommendation number 7 in preparedness. So one of the things that the task force spent a lot of time talking about was really the health of the community before, during, and after COVID. It's really, not as simple as sort of thinking if we were just healthier, then we would do better. It really is around trying to understand the walkability of the communities and the resources that are out there for people to have access to a healthy environment so that they can improve the behaviors that will enhance their overall health. And so that's the recommendation here. It's really to invest in that ongoing population health and behavior change research, and to leverage the academic and community partners that you have that really specialize in this area and focus on it a lot for the work that they do, and that bringing that together and sort of thinking through how can we enhance the overall health of the community will allow us to sort of weather and be more resilient in the future if we can reduce comorbidities within our community members.
And with this, if I may add, we recognize that we have a lot of talent within our academic institutions, UTEP, UT School of Public Health, Texas Tech University Health Sciences Center, and tapping into that expertise and those resources that we locally have are going to help us continue not only provide that guidance and support to our local pandemic efforts, but also in the future, as Dr. Brennan said, we can continue utilizing those and continue being partners in the way that we can fight some other comorbidities, pre-existing medical conditions that are more common because we are a majority of Hispanics. We have a lot of other issues that we recognize that are those social determinants of health that can put us at a disadvantage in many health-related issues.
Thank you, Dr. O. So, going back one on testing recommendation number 3. So we finalized those preparedness recommendations, and the next one was around continuing with data and having a mid and long-term recommendation there. And it really is as simple as saying, we hope that you'll continue to invest in ongoing COVID epidemiological research and surveillance, that continuing to sort of gather that data and communicate it out to partners will only sort of benefit us overall to help develop our plan for response as we continue down this road. Next slide. Transitioning to our testing and contact tracing recommendations. So the first one here is to expand passive disease surveillance and existing syndromic surveillance methods. So I'm sure most of you know this, but some of the things that we do to identify if something is happening within our community might be looking to see how many thermometers are being sold at our local pharmacies, or what is the primary chief complaint that people are coming into in the emergency room. And those are sort of warning signs to us that say something is happening, maybe flu is starting, or again, as a COVID-like illness is ramping up in our community. So the recommendation here really just to expand that and continue to utilize those methods so that we can be on top of these things as we go forward.
A little bit more in regards to the surveillance. The surveillance, it's not only within the COVID-19, it is something very common when we do it with influenza-like illness, where, as Dr. Brennan said, how many people go to the pharmacy before going to the physician and they start buying cold medications? How many people start having symptoms, but they don't even want to try medications? But that's where some of the technology can be applied, and by logging their symptoms or getting into this website where they keep track of the flu, it gives us an idea of how many people are getting affected. And it is not inherent to our community where we live those visits to the medical provider at the end when we already tried the folk remedies, when we already tried over-the-counter medications. And the combination of all the strategies is going to give us a better idea to be better prepared and not to catch us off guard when a bigger problem is already upon us. Thank you, Dr. Brennan.
Yeah, next slide. The 7th recommendation for testing and contact tracing is to develop, preserve, and promote partnerships to expand and diversify COVID-19 testing throughout the community. So a couple of elements here. The first one around expanding laboratory capacity, which I know is already happening or has happened. Then to create a plan for scalable testing response that leverages partnerships and current city initiatives So just to continue to build up whenever needed what we're able to do by leveraging our partnerships, and then to provide publicly available information repository for clinics and business operators on validated testing supplies, costs, vendors, and so on. So focusing on this last bullet a little bit, it really is about trying to make sure that we are having a consistent message throughout the community. And a good way to do that is to sort of provide the materials to the businesses or to the clinics so that they're not developing them on their own. So the recommendation here really is to try and have that repository of information so that we're not duplicating efforts or people aren't falling into sort of buying wrong products or buying from organizations that are not helping. Next slide. Okay. And then here in the home stretch, we come to communication. And you'll notice that because these are communication recommendations, they're slightly worded longer. We have here our first mid and long-term communication recommendation is really, so working with cross-sector collaborative should continue to effectively communicate with target audiences about COVID-19 and by creating and launching a unified dynamic health communication campaign. So really here just trying to get to meeting people where they're at, using different platforms, ensuring that messaging is appropriate based off of language or comprehension, and really leveraging behavioral health expertise within the community around health communication to do those activities. Next slide. Here we're talking about conducting an ongoing communication assessment that solicits stakeholder perception. So sort of that iterative understanding of sort of how are we doing and is there something else that we could be doing? So really hearing from the stakeholders if there's some better way to be communicating to them or if they're understanding if they're getting the messages that we're sending out. So modifying, adjusting those messages, trying to be as creative as possible so that we meet the needs of the community. Okay, next slide. As we just sort of touched on, again here, this recommendation is talking about providing consistent quality communication resources. So the last one sort of focused on more of sort of the scientific side here. We're talking also just that this leverages into that communication piece and trying to make sure that we're being consistent. And then using the resource of the city website that contains materials that everybody needs. This goes back to sort of that theme we had in the short term around sort of the no wrong door. If we can drive everybody to El Paso Strong and then hyperlink between other websites or asking our partners to link back to us, that will make sure that everybody understands that we are the source of authority and that they can trust that they'll find what they need on our website.
And if I may add, this is quite important in which we can be a source of many resources for all the community, and we've been able to add a lot of information to epstrong.org, and we want to continue doing that, and we want to continue being the source of proper information to the community and to many other communities also if they want to model what we have. And our main objective with this recommendation is that it's going to have the repository of things that might be necessary for businesses, for healthcare professionals, for the community in general, to have this kind of information where they're going to be useful in the course of business that they have, but also is going to promote that same consistent message that we want to continue to give to our community in regards to the COVID-19.
Next slide. So last but not least, this is again referring back to the evaluating after action reports and trying to make sure that we are evaluating the communication as part of the response. So that's what we're talking about here is as part of the after action to really look at how communication was conducted and to think about lessons learned from that moving forward and continue to collaborate across our public-private partners who were also sponsoring communication efforts throughout this time and try and see how they matched up and if they were really leveraging each other and building off of each other effectively. And as I mentioned sort of at the beginning, we understand that many of these recommendations might not happen exactly within the 18 months, but we felt they were important enough and spent a lot of time discussing them to make sure that they made it onto the mid and long-term recommendation list. Thank you very much for allowing us to present where we ended with the mid and long-term recommendation.
Thank you.
Mayor Margot is having technical issues. He's trying to log back
IT,
in.
next slide, please.
Next slide. And we'll hand it off to Mr. Coronado now.
Good afternoon, Mayor and Council. David Coronado with Bridges. So today we wanted to give you an update on the new data sets that we have from not only the city, but also the county and then at the state level. So next slide, please. We have here on the first slide the unemployment rate for El Paso County. So you see that there's been a really, really good recovery in the unemployment rate and also insurance claims throughout the county. You see that, we peaked at about 15%, just 4 months ago. And for the last 4 months, it's been on a constant decline, steady decline, really sharp decline, which is really good for the economy, really good signs of the recovery. We're seeing similar signs in the U.S. and also in Texas. Right now in the U.S., the unemployment rate is a little bit higher than El Paso, just a few percentage points. And in Texas, we're right in between. So we're not doing as well as the rest of Texas, but we are doing much better than the other regions in the U.S., which again is good for our region. Next slide, please. Here we have production in the U.S. We have employment in Juarez at the top, and then also we have trade in the El Paso district at the bottom. So here, similar story, really good positive signs of a recovery. We're not yet to pre-COVID-19 levels as far as production goes in the U.S., but trade, as far as trade goes in El Paso, this is actually an outdated slide. We have a new data set in the city website. We actually surpassed trade in June at about $7.2 billion in trade. We surpassed pre-COVID-19 levels just 2 months ago. And so again, really positive signs. There's only really there's two regions in the El Paso, in the Texas, in the U.S. Mexico border that have accomplished this. This is El Paso, the El Paso district, and Otay Mesa as well. So again, really positive signs. It appears that it's, really early signs of a V-shaped recovery, which is quite shocking. We were expecting a really slow recovery over the next few months as we progress over time with this pandemic. But again, trade numbers, employment numbers, positive signs. Next slide. And then here we have, again, positive signs with the exchange rate. It's been really volatile since March. It peaked at about 25 pesos per dollar. And since then, it's been on a steady decline, which is, in the end, overall, it's going to help not only the Juarez economy, but also the El Paso economy. As soon as the restrictions are lifted for non-essential travel, that this is going to help those purchases come back to El Paso. As those travelers return to El Paso, those Mexican travelers return to El Paso once the conditions allow. So again, really positive signs as well, steady decline since March. And then at the bottom, we have sales tax allocations. Again, also positive signs, year over year, 3% increase in July. really good performance for May, June, July, after 2 months in March and April of decline compared to 2019 numbers. So again, overall, as far as the economy goes, sales, unemployment rate, employment numbers, trade, positive signs, again, like I said. Next slide. And then here we have, the trade numbers. 2 weeks ago, we talked about how wait times have been impacting the way that people behave and how they cross to and from Juarez. You see here that story, right, in blue. Crossings for vehicles continue to be unsteady. Right now it's at about 30% decline compared to 2018 levels. We were on pretty good solid ground, negative 25%, and since late August, that's been pretty unsteady, behavior as people trying to readjust and go from driving a vehicle to crossing on foot. And so you see here at the bottom, the line in yellow. You see the steady increase on pedestrian crossings as well as people, switch from a vehicle to walking, and then also pretty good performance on the cargo side, which again goes back to the train numbers that we saw just a couple of slides ago, right? And so so we're gonna keep track of these numbers. In June and August, we expect that growth in trade to slow down because you see this as a leading indicator of that other number that is lagging, right? The trade figures. So we'll just keep track of that and then keep you updated. And the next slide, and then if you recall, we also have been tracking mobility patterns in the El Paso County, not only for U.S. Home devices, but also Mexican home devices. If you go to the next slide. So, in short, what we're finding in the data from SafeGraph is that right now, El Paso, as far as this data set goes, the sample of the data, total business visitor activity throughout the El Paso County remains at about 70% capacity pre-COVID-19 levels in early March, before we were hit by the pandemic here in El Paso. So 70% capacity for total business activity in the county of El Paso. But when it comes to Mexico home location devices, those devices that cross from Juarez into or other states, parts of the country into El Paso, right now that stands at about 30% capacity. So you see that the travel restrictions, wait times are impacting the way that people behave in our two sister cities. And so we have been recovering in a steady recovery throughout overall in the region. But again, those home location devices in Mexico have not come back, again, due to the restrictions and due to the wait times. Go to the next slide. So this is mobility patterns for El Paso County. That's the figure for the entire region. You see how it bottoms out in April, about 40% capacity from just a month before in March. And then right now, pretty steady recovery. And then you see those figures throughout the June, July months. You see a little bit of a slowdown with the June closures at the end of June, reopening up again. And then you see right now we're tracking about 70% capacity. And if you go to the next slide, totally different story. In the next slide, we have those devices coming to El Paso from Mexico. You see that sharp decline in March, bottoming out also in April, but at about 20% capacity, not 40%, but 20%, slow recovery. And then in August, late August, you see a little bit of a slowdown again because of the wait times, because of the less lanes being open at the ports of entry. Again, you see that again, another downturn in this metric with those devices. And if you go to the next slide, we can also track this not just for the entire county, but also throughout industries within many sectors within the economy of El Paso. Here we have the top NAICS for El Paso when it comes to Mexico business visitors. General merchandise stores, real estate, food and drinking places, pretty stagnant trends. You see the sharp decline, not a whole lot of recovery. You see that here in these three top NAICS sectors. And if you go to the next slide, more detail, education, flat. There's been no activity here in education, flat on healthcare, flat on accommodation, flat on amusement and recreation activities, a little bit of a spike in parks during the summer months. And then if you go to the next slide, more detail, more industries, electronics, furniture stores, vehicle repairs, food and beverage. Again, look at the trends, decline, and then flat, decline, flat throughout pretty much every single sector of the economy when it comes to those travelers coming from Juarez, again, due to the restrictions and then worsened by the additional wait times and conditions at the ports of entry. So that's the update for today. We have a few more slides and updated data sets on the city website. We were updating them this morning, but that's all we have today for you all. Thank you.
All right, thanks, David. IT, if you can go to the next slide, please. So looking at the financial focus section, just provide you an update on where we're at as far as the encumbrances and what we spent as of late last week. Again, just looking at the strategy again of what was the key factors in determining the programs that we've allocated the coronavirus relief funds towards. So looking at, again, not only looking at the short-term successes, but also looking at the long-term impacts we can have on the community. Again, focusing on the community and economic response, and as well as our employees, again, ensuring that we have safe facilities for them to come back to work to, and also safe facilities for our customers who are utilizing our facilities. Next slide. Again, this is a breakdown of the 3 buckets. Again, looking at the public health and safety, community response, and our economic response, and the allocations. Next slide, please. Looking where we're at as far as late last week, as far as encumbrances and expenses. So you can see 49.3 million that's been encumbered, another 22.1 that's been spent as of late last week. Just over $47 million remaining out of that $119 million allocation. So again, that equates to about 60% that's been either encumbered or expensed as of late last week. So a few meetings ago, I showed you all the expected cash flow and where we're looking at as far as expending these funds. We're still on target. We have a couple of programs we continue to monitor very closely, particularly with community development. So you're hearing Nicole Farini talk about some of the things on their side with some of the programs, particularly in regards to rental assistance. And so just, again, continuing that we're monitoring, make sure that where possible we can reallocate these funds as necessary to ensure that we do spend all of these funds prior to the December 30th deadline as set by the federal government. And also just a reminder, I'll let you all know also, so we do have the quarterly report that's going to be required from the Office of Inspector General. That quarterly report will be for the months of July, August, and September. That report will be due October the 13th. There's a lot of information that's required to be submitted to the Office of Inspector General. We've already compiled that information. So now it's just a matter of making sure that we've got all the details ready to go. That'll be submitted through the portal that was set up to the federal government. So at the next council meeting, I'll provide you an update on what we submit as far as that quarterly report. Next slide, please. So again, just looking at the public health and safety, again, a large majority of the funds going towards these programs, 82.1 million. A majority of that, again, going to operations, emergency operations. You have an item on the agenda tomorrow to approve for another facility that's going to help assist towards these programs. Reopening safely, again, so some of our teleworking and reopening preparations in order to get our employees and our customers back into city facilities. And then finally, the workforce support as far as economic assistance or employee assistance in healthcare claims, and also providing some additional training for our employees. Next slide, please. So this is a breakdown of the emergency operations piece. Again, that's 69.2 million. You can see the breakdown there by different programs. Again, we have 16.3 million encumbered, another 8.3 expensed. One of the large items, again, is that facility that's on the agenda for tomorrow related to lab testing. And so that, again, is in conjunction with the various programs we have to help address the COVID-19 response and what we're doing on the public health and safety side. And then with that, I will now turn it over to Tracy Durham, who's going to brief you all some more on testing recap and an update there.
Thank you, Robert. Next slide, please. So we have had an increase in our average daily testing rates. As of Friday, when this presentation was submitted, we were at an average of 1,885 tests per day, which was an increase of approximately 8%. Over the previous reporting period. We've received updated numbers today, however, and our testing has actually gone up by about 23%. So although we are seeing an increase in cases, we are seeing that people are taking this seriously and getting tested, which is really important. Because again, as has been mentioned, our positivity, or I'm sorry, our asymptomatic rate remains at about 25%, which means you may very well be carrying and spreading the virus and not be aware of it. So incredibly important to continue to push our numbers down, making sure that you're being tested. Our cluster management team, per the scoreboard dashboard, continues to focus on our most vulnerable populations. That's their focus priority at this point and will continue to be so. These are nursing homes, assisted living, and long-term care facilities. And as legal staff briefed earlier today, this is going to be increasingly important as visitation from family members is now allowed per the governor's new orders. And again, we want to make sure that our most vulnerable populations really stay healthy and stay well. So that work is more important than ever that's being undertaken by our cluster management team. Next slide, please. Again, we continue to support our testing sites, making sure that we're maintaining and expanding our capacity as we are able, and making sure that everyone in the city, regardless of where they live, has accessibility to testing. We have been working very closely since the beginning of the pandemic, of course, as you're well aware, with our different school districts. And the Department of Public Health and the Office of Emergency Management have really been leading this relationship and support that has evolved over time, dependent on what the school districts need and what the needs are of the community that they're servicing. What's been really great is as this relationship has evolved, we're really now in a broadened health and wellness collaboration. And not only are we looking at the way in which we can support the school districts in their fight against COVID-19, but as we've discussed, the influenza prevention this year is more important than ever, given that we are concerned about the combination of those two issues coming together for people. So, for example, Clint ISD recently hosted a 2-day weekend event, and they distributed about 1,700 flu shots during that period. If you visit the bepowerflu.com, so it's bepowerflu.com website, you can see a whole list of other collaborative programs that are going to be offered through the month of October with a variety of our partners, our school district partners, including YISD, Fabens ISD, San Elizario ISD, EPISD, Tornillo ISD, Canutillo ISD, and Anthony ISD. There will be drive-through free flu shot clinics that are going to be held, again, in collaboration with the Department of Public Health and the Office of Emergency Management with our partners. So again, this is an incredibly important collaboration that we will continue to build on. I'd also like to mention that Project Vita, another one of our partners in the fight against COVID-19, is also working with us to offer a number of flu shot clinics. Next slide, please. Again, we have 2 pages here of our current partnerships that continue to spread and to develop over time. Next slide, please. And these partnerships are incredibly important to us. As you know, the federal government has provided a great deal of support, as has the state of Texas, but we want to continue to make sure that we are assuring our collaborative partnerships across lots and lots of different areas, both public and private, and different partnerships, so that we can make sure that we are ensuring our capacity, regardless of what the needs and the demand may be across the city. Now, again, our testing has gone up, our testing demand, but again, we're at less than 50% of what our daily capacity is. So we really want to make sure that people are going out and getting tested. Next slide, please. This is a list of our current sites. And our 2 city drive-through sites, the one that's located on the east side and the west side, are also going to be offering, in addition to COVID testing, they're going to also be offering free flu shots. There was a press release that went out today. The services will be offered Monday through Saturdays. And so again, we really encourage people to take control of their health and wellness and take advantage of those services. And again, as mentioned by the city manager, at the time that this presentation was submitted, the relationship or the commitment, of the state to remaining here for testing was confirmed through mid-October. We just received confirmation today that the state will remain with us through at least the end of October to support our testing efforts. So we're very happy about that. Next slide, please. And now, do we have a video? We have a video to share for some of the new collateral that's being created by PIO. If we could go back to the presentation, please. Again, PIO staff continues to create new collateral all the time, supporting our
When all this started, I was sent to work from home.
And this is a patient testimonial.
When all this started, I was sent to work from home by my director because they care about us being safe. But the thing with COVID is that you don't know who might have it. I mean, it's something very, very new. So I ended up getting it. Luckily for me, I didn't get it as bad. It was mostly stomach issues, but it did send me to the ER.
Thank you, Council, for sharing all of this information, and thank you to our members of the press who continue to share our information out to support our efforts in keeping our community safe and well. Thank you.
Good afternoon, Mayor and Council. Nicole Farini, Community and Human Development. I'm also calling in from my phone today, so apologies for the shaky video. Next slide, please. So just as a reminder, the Community Vulnerabilities and Human Services team, once again, is focused on addressing the needs of the most vulnerable as we navigate through the impacts of COVID-19. Really looking at housing affordability, utility cost burden, food access, and financial stability of El Pasoans, but making sure also that our investments are inclusive and promote a resilient recovery beyond the course of the pandemic. Next slide, please. So you all will remember this slide. I've presented it a couple of times. This is sort of the path towards an inclusive and resilient recovery where you have to take a look at your pre-COVID-19 conditions and the vulnerabilities that existed then, moving directly into the emergency response mode, which is really where we were for the past several months. We've now moved into, and I've got it highlighted here, a stabilization period, particularly with the community response and recovery programs. So we've deployed a large amount of the funding, of the CARES funding, that was both coronavirus relief from the Treasury as well as entitlement funding, and invested in those programs where El Pasoans needed it the most based on our community needs assessment. Looking forward, we are moving on an upward trajectory and supporting our partners to do so that we can move it more into that adaptive recovery phase, and then ultimately moving into an institutionalization of a lot of the best practices that we've uncovered as a result of the crisis. Again, looking forward to that recovery period, not just a response period. Next slide, please. So I bring this chart back. It's something that you all have seen before. You'll recall when we initially started discussing the CARES funding, we started in phase one with a robust community needs assessment where we reached out to numerous community stakeholders, both individual residents in the community, as well as our social service providers, so that we could assess not only the need, but also the capacity to deploy the CARES funding and the relief that we were planning for. We then moved into phase two, which was prioritizing the funding that was made available for community response. That came forward to you all during phase three, where we implemented the action plan that you all remember deployed the funds into several categories that I will go into here in a moment. But I bring this slide back because we're now in phase four, which is the performance measurement and impact assessment phase. And I bring it back because as we move through the deployment of the funds, the implementation of the programs, we're constantly receiving feedback, not only from the community, but also from our social service providers, our nonprofits who received the funding, in terms of how we can make sure that those funds are getting to the most vulnerable, to the people who need it the most, and for the right purposes, and making sure that we're having the kind of impact that we're looking for in stabilizing our community during this crisis. Next slide, please. So as a result of that process, that phase four of the process, we continue to work with our partners. I think one of the misconceptions about the way that the municipality works, and specifically the way community and human development works, is that we receive the funding from the federal government. We then pass that through the robust process that I just mentioned. But once those funds are deployed and those contracts are executed to our partners, we don't just walk away and say good luck and then come back when it's all over. We continue to work with our partners. We're in constant communication with them. And in recent weeks, we've really taken a look at the timeline. And as Robert mentioned in his presentation, we're very, very closely monitoring how effectively those funds are being deployed and what the results are, the impacts in our community are of those programs. In speaking to our partners last week, we heard some common challenges across the board. There's a lot of discussion and challenge in terms of individuals across our community proving economic hardship due to COVID through the negative income impact that you all recall from the many discussions we had as we proceeded with those contracts. We also are seeing in some cases, not all, a lack of applications, a volume of applications coming in from the community. And I'm going to go into a little more detail as to why we think that's happening in some cases. But in terms of the spend and really getting those dollars deployed before December, a lack of applications is a challenge. And we need to make sure, and I think this is where we can definitely leverage the communication that you all have with your constituencies, as well as a lot of the marketing efforts that are out there, whether they be through the City of El Paso or through our community partners, the fact that not only is this funding available, but it will not be available forever. And so it's very important that the community understand that if they are in need of assistance, please don't wait. Please apply now. Please make sure that you get in under the wire in terms of the timeline of deploying this funding. In addition to that, there was some other concerns regarding the robust restrictions that really were implemented as a result of the Treasury regulations that came down to us from the federal government. So we're continuing to work with our partners to make sure that we're deploying training as well as working with them and their accounting staff daily to make sure that they're able to provide the appropriate backup. That goes back to the risk mitigation conversations that we had extensively with the council and with the public. So again, deploying the funds where they are needed most, but also making sure that we're deploying them responsibly in line with the federal regulations. Some of that uncertainty and some of those restrictions we heard from our partners are really resulting in a conservative spend. And so what we're trying to do now is, again, work with them to encourage more certainty in terms of what is allowable and making sure that we're able to accelerate the spending of those funds. Again, accelerating the spending of the funds just means getting those dollars into the hands of those that need it the most. Oh. Okay, I think that's okay now. Oh, I'm hearing a little bit of an echo. Okay, all good. So I just want to quickly run through, you'll see here September 21st was when we really began implementing some of the proposed solutions to the challenges I just mentioned. We will be circling back with every single one of our funded agencies October 1st, which is this week, to do a soft check-in and see if those solutions are working for them and see if there is a variance in the trend in terms of getting those dollars out. I really want to emphasize, though, that really by mid-October is when we're going to be looking at, is there an opportunity to reallocate some of those funds to other programs where the need has emerged. And we're continuing to communicate with the community at large. We're in community development. We're in constant contact, obviously, with the budget staff and the comptroller's office to make sure that we're on target for spending by December. Next slide, please. So getting back into the phase 4 portion of this process and really looking at measuring performance. In the context of rental assistance, utility assistance, and the community assistance fund, we have seen a lag in spending. And that's as a result of a few things that I've already mentioned, particularly in rental assistance. We're not seeing the urgency on the part of the public in terms of applying. And part of that is because we see that there's a misunderstanding of the moratorium on evictions. Folks are not being evicted now. There's a number of different orders that the city attorney goes through every time we brief. But I think that anecdotally we're hearing from the community that folks are not prioritizing applying for the assistance because they feel as though they can't be evicted today. This is a problem because a moratorium on evictions does not mean a forgiveness of that debt. And so as we see El Pasoans move through more and more months of this pandemic, what we're seeing is folks basically accruing a large rent debt. And so we're approaching a cliff that if folks really don't understand the urgency and apply for the assistance now, we're going to see a lot of folks that are in desperate need following December. And so we encourage folks to apply now and receive that assistance. We've expanded the amount of money that folks can apply for, as well as expanding the number of months that they can apply for assistance. So it was 3 months previously. Now they can apply for even more than that. To date, just under 3,000 renters have been assisted. In the context of utility assistance, we are seeing the demand, and in working with our two community partners, Project Amistad and El Paso Water, we are hoping to see by October 1st a dramatic increase in the number of utility customers assisted. So far, it's been just over 200, which again, compared to the number of applications that have been received, we expect that number to increase significantly in the near future. In terms of the Community Assistance Fund, 134 debit cards have been distributed to date, and they are processing and screening between 10 and 15 clients per day. But again, this is a fund that we heavily invested in, and we need to make sure that folks understand that these dollars are available, but they will not be available forever. So we're measuring the results, as I've shown here, but we're working closely with these partners to target improvements in the deployment of those funds. And that's really what that entire process that I described a few moments ago is about. Next slide, please. In the context of addressing those folks that are most vulnerable in our community, you all have heard me speak extensively about how we have invested in protecting our homeless population. Again, I can't emphasize enough that by getting in front of this issue and making sure that we are protecting and preventing the spread of the contagion amongst the homeless population, we're also protecting the community at large. Since April of 2020, the Delta Welcome Center has sheltered over 2,000 individuals. They have tested 479 individuals. We maintain a 0% COVID-19 origination rate at the Delta Welcome Center. And that is really an important thing to understand in terms of the success of our investment in this congregate facility. In terms of investing in transportation, there's been a total of 509 trips. The transportation in those trips, what that is our investment in allowing folks that are homeless to access transportation to a testing site, as well as to isolation and quarantine facilities. So again, making sure that we're not leaving out these most vulnerable and that we're providing the resources that they need to be able to protect themselves as well as the broader community during this pandemic. In this sense, we're doing very, very well in terms of spending the Treasury dollars, the CARES Act dollars. But measuring results in this context is not about increasing the spend. Rather, it is about informing our solutions going forward. And you all have heard me speak to the $3.9 million that is currently pending award from the Emergency Solutions Grant Coronavirus Phase 2. That funding is targeted specifically at transitioning out of the temporary Delta Welcome Center and making sure that we maintain the success that we've achieved so far and can move on to a more permanent solution. Next slide, please. And finally, investing in the support services that really wrap around rental assistance as well as homelessness. We've had a really robust amount of success. In terms of rapid rehousing, these are the dollars that we invested for folks that are displaced. These are folks that have lost their place of residence, their opportunity to shelter in place, and need to be housed permanently and quickly. And so we've invested $1.2 million in that program. So far, we have been able to place 50 different households that were displaced as a result of the virus. We have also been able to serve just over 700 persons in the context of the funding we allocated towards abuse prevention. So that's the Center Against Sexual and Family Violence, Casa of El Paso, and the El Paso Child Guidance Center. I also want to point out, because we talk about it quite often, the food security issue. Food security has been something that we've all had a keen eye on since day one of this pandemic. We've invested just under $3 million in El Pasoans Fighting Hunger via the CARES Act and the entitlement. And I have to call out these tremendous numbers. Over 319,000 people, and just let that sink in for a moment, 685,000 people in the city of El Paso, 319,000 of them have been provided food access between March and July at the food bank. That is a lot of people. They have distributed 49 million pounds of food, again, in that same time frame. So again, continuing to support food security, continuing to support El Pasoans Fighting Hunger, as well as the other systemic partners that provide additional food security for families. So here, in measuring these results, what we're looking at is how do we need to continue to invest to make sure that we're able to continue that service as this pandemic extends longer than any of us anticipated. And in a final note, the child care program that I briefed you all on 2 weeks ago with the YWCA, that contract has been executed. That program has hit the ground. We are hoping that at the next council session, I can brief you all on a success story there. I can just tell you that in a preliminary fashion, a huge number of applications have been submitted to the Y, and they are processing those now. So again, I hope to be able to give you some good news in terms of El Pasoans that have been assisted, particularly city employees that have been able to access free childcare as a result of your investment. And I believe that is my last slide, and I'll turn that over to Jessica with, oh, I'm sorry, one more slide. This is the link to the Community and Human Development webpage at elpasotexas.gov. Every single one of the community assistance programs that I have mentioned can be accessed through this page. And so with that, I will turn it over to Jessica and your economic recovery update.
Good afternoon, Mayor and Council. I'm Miranda Diaz with the Economic and International Development Department. Today I'll be presenting economic recovery. Next slide, please. I want to start with a tour of the epbusinessstrong.org website. I'd like to get control, if possible, so I can share my screen, IT. Okay, so you all should be able to see it. As I mentioned a few weeks ago, this is the epbusinessstrong.org website, and it is going to be consistently updated with information that helps our businesses pertaining to COVID and helping them keep their doors open, make sure their employees and their customers are safe. As you'll see right here at the top, we have the different tabs with different information. Previously, we had the 3 main grants on the front page, but of course, we have to show all the programs. So those grants are now located under financial assistance. So anytime a business calls and asks, hey, I'm trying to look for information regarding the grants that are being given out, you can just let them know it's under the financial assistance tab. Also, the website is now in Spanish. So that's a great thing, so we can get Spanish speakers, Spanish businesses to be able to understand what's going on as well. And I'll just give you a small tour. We do have the local and state health orders that pertain to businesses. Any questions, FAQs they may have, they can refer to this. Then there's the safety tab, which answers a lot of their questions. How can they keep their customers safe, their employees safe? Again, this is going to be information that is pertaining just to the businesses. Then there's information on where they can source PPE. This page was in collaboration with the MCA and BioEPJ. We also have the UTEP dashboard that'll be up soon. And then here's information on testing. This is geared towards the businesses. We still have information on testing on our epstrong.org website, but again, this is going to be geared more towards businesses. So this is a toolkit that gives the businesses a lot of information, again, FAQs that they might have, And that way they could go here and get some more information. Then we have the financial assistance that I just showed you. And then the resources that are out there to help businesses that aren't necessarily monetary, but it is help to keep them online, open, and being able to sell their products, even if their doors have to close again. So again, this is the website, epbusinessstrong.org. We need your help in having to get the word out about this so that way the businesses are able to benefit from all the resources being offered. And also, I'd like to give a shout out and a thank you to PIO and P&I. PIO had put together a press release last week on the website. They emphasized the website, and they also gave information on the grants and information from the Hispanic Chamber. And they scheduled a podcast interview in Spanish. That way, the 3 grantees could give information on the grants. And P&I has changed their hold information to direct businesses to epbusinessstrong.org. And also they're sharing grant information with any of the businesses who call the one-stop shop. So any help that we can get from any of the departments is greatly appreciated. Okay, IT, if you could go to the next slide, please. And this is just the pledge to safety. We've had a really good response from businesses. The 256 was as of last week, and as of today, we actually have 272 businesses that have signed up. On Saturday, we had a large number sign up, so it's great. The word's getting out. The businesses are taking the pledge to ensure that their employees and their customers are safe. Next slide, please. And with that, I'd like to introduce Cindy Ramos Davidson from the El Paso Hispanic Chamber, who will be giving more information on the programs that they're offering in regards to COVID. Cindy, you're on mute. Okay, I'm not sure if she's having any technical difficulties with it, but as you can see on the slide, these are the upcoming webinars that they're having. They're in English and some are in Spanish. They've been having a great turnout for both of them. And also on the business safety kits that they've been giving out, they were anticipating setting up appointments with businesses to go in and pick them up. Unfortunately, because a lot of businesses have had to lay off employees, they're the only one there. They're unable to go and pick up the business safety kits during regular business hours. So the Hispanic Chamber has been going above and beyond what was asked of them. They've been setting up appointments after hours, going out to the businesses and handing out these business safety kits that are needed by the business. And that's it from us. Go ahead and hand it over to Carrie.
Good afternoon, Mayor and Council. Go ahead and go to the next slide, IT. So I'll give you a brief operations update. So here's the status of personnel hirings that are supporting our response efforts. We've hired the additional contact tracers, and the other hires and recruitments that you see on this slide are directly supporting our testing efforts. Next slide. So as we continue to make safety modifications to our city buildings, what we've also been doing is we've been evaluating different types of clean air technologies, both plasma air ionization systems that are really geared more towards smaller facilities and smaller air capacity and volume, as well as UV light systems for the larger buildings. Next slide. So we selected 4 firms. We anticipate having the systems installed by the end of December. And you can see the facilities that we're programming the installation of those air technologies. Primarily, some of our larger facilities are those that get quite a bit of traffic. Next slide. And this is just an update on the safety modifications that we continue to do at our city buildings. And you can see the list here. These are the facilities that are in progress right now. quite a few of the facilities that we're doing now, we've moved to a lot of our quality of life facilities. Next chart. And sometime back, early on in this process, I briefed that we wanted to get a bench stock of PPE so that we would have a good amount of inventory on hand. Our goal was to have 3 to 4 months supply on hand. We now have at least 4 months supply so that when we return to work, we'll be able to have adequate PPE, not only for our employees, but for our customers and our residents that do business with the city. And that includes not only personal protective equipment, but it also includes cleaning and disinfectant items. Next slide. And we continue to rotate through our city buildings and deep clean with a number of the fogging systems that we have in place. You can see an illustration of that being done on the left. And our janitorial staff is going to continue to do the expanded daily cleaning. I had talked before that we had amended our janitorial contracts so that they do more than just the standard cleaning of our facilities. Now that will continue. Next slide. And so that concludes our overall cross-functional team update for this city council work session. And I'll turn it over to the city manager for some final comments.
Thank you, Kerry. Mayor, City Council, I just have 4 points I want to make here towards the end, and that is that we've been very agile in our response to this virus. I know that when we had the resiliency plan integrated into our strategic plan several years ago, what we did is we really demonstrated a resolve to execute the resiliency plan. That pushed us to meet with community partners in 2018. As I mentioned before, I know that the mayor was there, the mayor pro tem at the time, Ordaz, and Representative Hernandez was there as well. And at that time when we met, we really all committed to working with one another and really have silo breakers so we don't have silos where the left hand doesn't know what the right hand is doing. And we really initiated a lot of the teaming concepts that have been around for decades. These teaming concepts, which we call cross-functional teams, not only did we do internally, but we also did in the community through the community task force. These teaming concepts have been around for decades. The Harvard Business Review has done case studies on it. Sloan Management Schools, the private sector has done it for a very long time. The military has also utilized these cross-functional team concepts in their striker team concepts that they've initiated and have had incredible success with. The one item that I mentioned where we were recognized as a national leader and were given that, earned that award, quite frankly, was a result of having different departments working together for one common goal. That also has benefited us whenever we've worked with these partners in the community like UMC. So we've done training together on Lean Six Sigma. Again, Lean Six Sigma is the elimination of waste on the lean side. The Six Sigma part is standardizing deviation. And what all that means is you can improve customer service through process mapping. And we were able to connect with UMC and work with the state and really take ownership of those sites, even though we weren't the ones that were providing the service. And we shared some concepts with them, and we reviewed all of them with our teams, and we provided a map for them to give better service to our community. So they were very open to it because we had the facts in front of us, and they were able to, again, improve the customer service to our community. And you hadn't heard those complaints you heard before because we introduced those customer service improvements to them, and they pushed it out. One thing that we brought to the council that we wanted to do a heavy push on because of COVID was the flu push, and we called it Power Flu. The Power Flu program has been very successful. I know that the council was very supportive of that. We thank you for that. We want you to continue to push that information out through your emails in the email distribution lists. Again, we've already given vaccines to as many people as we've done all of last year. So that has been wildly successful. And then finally, I want to commend the council and also our financial team for us bringing forth some very tough decisions for you that you took action on, including a concept that initially y'all had some questions about, and that was the rate stabilization fund. At that time, that rate stabilization fund, the questions that y'all had, we came back and we answered those questions. Once y'all put it in place, 2 weeks later, the pandemic hit. So those were worst case scenario financial tools that we put in place that really position us for the future of any possible catastrophe that might happen. And we've already had 3 with the immigration crisis, with the unfortunate incident in August, and now the pandemic. So this year, when you get an update later in the next month or so, or the end of the year, about the money that's available in the fiscal year that we just ended and how much we have year-end money, before everybody gets big eyes and says, well, we have all this extra money, how do we spend it? We have to realize that we're not at 100% on service delivery right now. So whether we have 10, 12, 15 million left over, it really wasn't left over. That happened because the sales tax came back quicker. Our policies are working. Your policies that you've approved, that we go out and execute in terms of having education programs for our businesses so they can get back up on their feet safely with programs like Pledges to Safety, the Live Active El Paso that we've been pushing out. And again, we are citing folks. We even have a complaint, an email about restaurants complaining that we're citing too much. And that just came through across your email screens, I think. So we are doing that as well, but it's a delicate balancing act. And so we want to help these businesses get back on their feet sooner. Again, the money that comes back, we're going to recommend that the majority of that go to a rate stabilization fund so that in the future, when we do next year's budget, come back at 100%, the tax rate isn't impacted as much. So again, if you see a $15 million figure, you say, well, we got $15 million. Well, if you need 38 for the next year, then you're down 23 million. So I just want to give you that as a look ahead, a read ahead, if you will, of what's coming. So when you get that report, don't think we have all this extra money, because that has to go, in my view, what I would recommend towards how we level off next year's budget. So thank you for listening. That concludes our presentation. If you have any questions, we're happy to answer them at this time.
Representative Lazarga and then Representative Hernandez have questions.
Thank you, Mayor Margot. Thank you, Mr. Gonzalez, and all your team for your presentation. I have a question for Nicole. Are you there still, Nicole?
Yes, ma'am.
Hi, Nicole. You were talking about the lack of applications, and then you were talking about the rental assistance. What other areas are you not getting applications? Is it just the rental assistance?
Yes, ma'am. It's primarily the rental assistance where we're seeing a lag. I don't want to make it seem as though we're not receiving applications, but there has been a slower uptake than we expected. I think, if we look back to where we were in, May and June, and we were seeing some other cities deploying, mass amounts of money in a very short amount of time, we're just not seeing that here. But that does not correlate to a lack of need. And so that's where we're getting our assumption that it's really just a lack of applications. And so that's primarily where we're seeing it. We do, though, want to encourage, utility assistance as well. Folks' utilities are not being shut off right now due to the emergency order. And thank you to our utilities for recognizing that need in our community. But again, what it does is it sort of it dampens the urgency of folks to get in front of applying for the assistance. And so those are primarily where we're seeing it, mostly in rental, a little bit in utility, and then also in the Community Assistance Fund. Folks need to understand that that is a program built for individual household needs that we're not dictating, right? The council spent a lot of time discussing how up to $1,000 on a limited use debit card that can be used at groceries, supermarkets, and pharmacies. So families that, for example, cannot afford their medications right now, the debit card can be used for that. And so those are really the major areas that we're asking for assistance and really urging folks to apply.
So is there some kind of one-pager that you could send to us so that we could send that out?
Yes, ma'am, absolutely. We can put something like that together for you.
Okay, thank you so much. And then my other question was about the $3.9 million for the homeless solutions.
Yes.
I know you said it's currently pending. So what kind of timeline are we looking at for that?
So the team is currently evaluating the responses that we received. What's unfortunate is that the responses we received really did not address as robustly as we need the transition out of the Delta site. And so that's what's taking a little longer than we anticipated. I hope to be able to come back to the council in a couple of weeks with a better answer for you than that.
Okay, thank you very much. Those are all my questions, Dee. Thank you.
Representative Hernandez?
Thank you to City Manager and to the staff. I do have a question, and I know we were having some technical difficulties, which is totally understandable. The scorecard, can you talk about when we're currently in phase 3, correct? And so if we continue to see the uptick in positive COVID cases, will you see that phase go to phase 2? And if so, when?
Hello, Representative Hernandez. I can answer the question. And actually, the scorecard is a combination of different points in different categories in which when they combine together, they're going to be moving up or down. If you notice, if you click on individual sections, they're going to have the scorecard stage where they are. And then you make the average of all those, and you have an overall stage number. So as we have the uptick in the cases, that one went down to stage 2. If the hospitalizations are going to go continue going up, it's going to go to stage 2. The deaths will continue to be in the same. The hospital readiness. And the way that we have the cases in vulnerable populations, that one, we haven't seen an uptick in those, and that is the reason why it hasn't moved that much per se. So you will see that it will move on the overall, but it's moving on the individual sections of the scorecard.
Right, and I'm on the scorecard now, and I see that all of the stages are in 3. For every different item on the rubric, if you will. And so I just don't know if this is going to, if we're on the path to going to stage 2, or if we're just going to be stagnant to stage 3. And so I thought, looking at this, we would be in stage 2 right now because of that dramatic increase.
Well, definitely we did see an increase, but we need to have changes, and some of the metrics on the scorecard are required to have a 14-day increase, and we cannot see much of the change in some of the metrics because of the same reason. There is a way that it's going to continue moving, and I believe yesterday or the day before, it was at number 2 on infection rate. We saw today that it decreased in the amount of cases, and that's why the days on a decline. Now you see that it's 1. And that's just an example, but it is like a dynamic tool, and it will move. It's not going to move as quickly the overall, but it will move on the different stages.
Well, no, you answered my question, Dr. Ocaranza. I guess I missed that with the 14 consecutive days. My assumption is that that it was 7 days, and I got confused with the 7-day rolling average. So if that continues on the to increase exponentially for 14 consecutive days, then you'll see that transition from that specific stage and from that specific item on the scorecard. Okay.
Yes, so that is correct.
Okay, so that helps me understand it a little bit more, so I can convey that to my constituents. Thank you for that. I'm going to move on to a new question. Mr. Cortines, I do have a question regarding slide number 53 for lab testing. And I guess I'm just curious because I'm a little concerned with the remaining balance on the line item for lab testing. It's about 20 million. But we only have a couple of testing sites open, correct? So what are like the other categories that goes under lab testing so that we can draw down those dollars? Or should we be having a conversation about how to reallocate those dollars to other descriptions on this slide? for example, preparedness or logistics, or possibly even transferring that over to community relief. So I just want to be honest about whether or not we're going to use those dollars, and if so, what is the plan to use those 20 million that are remaining?
Yeah, so I'll let Chief D'Agostino chime in with more of the specifics on that. So I'll tell you that, I mean, that's something that obviously we're paying very, very close attention to. So, whether it's rental assistance or whether it's programs within the public health and safety programs, we're monitoring to make sure that they stay on target with the expected cash flow. So some of those in the lab testing are facilities that they're purchasing. So some of those have already come before you. You've already approved one. You have another one on the agenda tomorrow. There's some additional clinics that are also coming forward, hopefully in the very, very near future as well. So you've been briefed on those as well. So those are the large items within that category. I'll tell you that I have a little bit of a concern as well, which is why our cross-functional team, our financial focus team, which is includes our budget director, our comptroller. We have a couple of other individuals on that team as well to make sure that we're monitoring, working very closely with these departments, and whether it's Chief D'Agostino, whether it's Nicole Farini, whether it's Jessica Herrera in the economic development team, because our mission and what's important to the community and to you all is ensure that we spend every one of those dollars that we receive from the federal government. We're not going to end up on December 30th with any money left over. And so whether it's reallocating like we did a couple of weeks ago, where we're putting more money towards the food bank with helping out with their staffing, whether it's putting more money towards the daycare, absolutely. We know we have a long list of priorities of where those dollars can go towards. And so, I mean, as I mentioned, we're working very closely with these departments to make sure that we are spending those funds.
So this is Chief D'Agostino. So part of that funding includes the facility. It's also going to include new equipment for expanding our testing capabilities. We've also got multiple contracts out with private laboratories to conduct testing for us. So we're not doing it all in-house, but we're looking at that transition to be able to test in the long haul. So what happens after December, we'll have our laboratory set up in a way, in a capacity that we'll be able to maintain this service for the community.
And Chief D'Agostino, does that, what you just referenced, is that what is itemized for the encumbered and expenses, that is not forecasted for the remaining balance?
I don't have that in front of me.
Okay.
Robert, I don't know if you can answer that one. Or...
I'm sorry, but I was breaking out. What was the question again?
That's okay. So let me try to rephrase that. What Chief D'Agostino just referenced, is that listed under the encumbered and the overall expenses for lab testing? So that's the 6.8 million for encumbered, and then the 2.7 for expenses. So what you described, is that already forecasted into those dollars, or is it being planned for the remaining balance?
It's being planned for the remaining balance. And so we're not setting those up until the council approves, especially on the facility side. We're not setting those up until the approval is actually done.
Okay. Yeah, I think you're right, Mr. Cortines. I think that pulling together a cross-functional team to include community and human development, as well as economic development. To be honest with you, what I'm hearing mostly from the public, and just to chime in on a potential redistribution or reallocation of these dollars, is essentially more support for businesses. I know the applications are still open. More support for nonprofit organizations providing critical services, and of course for food scarcity and for food access. And so I certainly will welcome that discussion. I'm just concerned because we're already, going into October, we have 3 months to these dollars into the community. And so that's what I've been hearing generally. So I just wanted to share that with you, and wanted to see if we can have a more descriptive plan on what we're going to do in the next 3 months to spend down the remaining 44 million of the total CARES Act dollars pending. But in addition to that, Mr. Cortines, I'm aware that we have other federal dollars, like FEMA dollars from Sun Metro. Maybe in a future work session, could you bring back what that drawdown looks like for those dollars as well?
Sure, we'll provide you an update. So we did discuss that during the budget process on the Sun Metro and the airport funding that they received. And so their plan's a little bit different than the coronavirus relief funds. And thankfully with their plans and with the money they receive from the FTA and the FAA is it doesn't have that December 30th deadline. And so they have a longer period of time in order to use those funds, which is a great benefit. And I'll tell you, one of the things that I'm hearing now, one of the things that we put together for the mayor to submit to Senator Cornyn was looking at what the request would be for future potential funding. And one of those is for more funding for the airlines. So I read something this morning that's one of the items that they're kicking around of potentially providing more funding. So that would be a great benefit. As far as the FEMA, we have not submitted a reimbursement yet. We are putting together our package. We have all the documentation. We will be submitting for a FEMA reimbursement. And so when we have that ready to go, we will update the council as part of the next financial focus section in the CFT update.
What was, Mr. Cortines, what was due on September regarding the CARES Act? Was that just like an update, or is that a quarterly report for the CARES Act dollars?
So by September 21st, it was the quarterly report that we submitted, and that was for the first 3 months. So April, May, and June. It was, if you remember, when I briefed this, so we did the initial, it was the interim quarterly report. And so what the Office of Inspector General did was they created a portal for all of the cities and counties and entities to go in to submit their reporting information. And so on September 21, we resubmitted, or actually we did a couple days before that date, but we had to submit essentially that same information as far as the dollars that we spent during that time period, but in the new format that they requested. And so it wasn't anything different than what we presented to you all. It was the same dollars. It was just reported differently. And then going forward now, and so on by October 13th, again, we'll have another quarterly report. There's more information that's being requested as far as the formatting. And like I said, whenever we have that information put together and finalized, we'll definitely update the council with that information. So we're looking at the next meeting, October 13th. We'll have that information ready to go to present to you all.
And I would like to add, Representative, that about 3 weeks ago, I talked to Robert and his staff about having different contingency plans on backup plans on what to spend the money on. There's a lot of need, and the objective is to get it all spent by the 15th of December, not the 30th. So we've already talked about various backup plans. I've already seen them, and I pushed for that 3 weeks ago. And prior to that, I had talked about the different ways to spend down that money on the different needs, especially if for whatever reason, that the money wasn't being spent in areas, albeit needy. If it's not being spent, it needs to be spent elsewhere, because there's a lot of need, as you pointed out. So we can put in more money in other areas if necessary. And all those backup contingency plans are in place and have been in place for quite some time. But I think it would be appropriate, obviously, to update the council if they have questions on that.
Thank you, Mr. Gonzalez. That concludes my questions. Thank you all for the good work.
Okay. Also, there's still more potential funding coming out of Washington. There was some approvals today, so maybe we'll get them out of committee. I know, Representative Manella, you asked to speak, but also we have Cindy Ramos-Davidson back on the phone, or was on the phone and whatnot. So I'm going to let Cindy go first and then Representative Manella. Go ahead, Cindy.
Good afternoon, Mayor and Council. I'm so sorry. I was trying to get in and it kept kicking me out. The world of technology. I just wanted to give you a quick update about the fact that our businesses that are out there that we're giving our safety kits, we've kind of retooled ourselves, and we are out on the streets knocking on doors because it's been difficult to get them to come into the center and do it. So we are available after hours, by appointment, by weekend. We're available by doing virtual. We've done some of these things virtual where we've talked to them, making sure they had all the policies and procedures that were necessary, and then we went and delivered the safety kits on their doorstep. So I just want you to know that just because there are certain rules and regulations that we need to follow to this, we are really trying to be creative to get to businesses. Many of them have not been able to come and get the kits that we've talked to because they have had to scale down, so they're just in their one little business with one person. So in order for us to combat this, we've just done some additional things to be able to make sure we get the intake forms. But I wanted to tell you, the comments we've gotten from the businesses is unbelievable in terms of thank you, somebody's listening, somebody's out there, and they really want to thank the city for taking the steps that they did to encourage all the 14 partners to recreate and retool with them to get these things out. The kits have been amazing. Many of the things they've gotten have been very happy about it, and the webinar trainings that we have done, we've impacted 552 people on the webinars that we've just done, and we've only done 4. So I want to just tell you thank you, and that we are out there and we're not taking no for an answer. We are just as entrepreneurial as they are as we retool and repurpose how to support our business community. Thanks.
Thank you, Cindy. Representative Bonello?
Yeah, thank you, Cindy. That's really great to hear. It means a lot, and thank you for your work on that. I have a couple questions. I think Representative Hernandez covered a few of mine, but one of them is for Ms. Nicole Farini. Nicole, so when you're talking about getting information out for rental assistance, what does that look like?
So one of the things that we did right away, excuse me, was we worked with our partners primarily at the Paso Norte Foundation and the El Paso Apartment Association. They got the bulk of the rental assistance funds, $10 million. Those are the Treasury dollars that have to be spent by December. The remaining $1.5 million that we put out for rental assistance is actually related to the entitlement, and so those do not have a deadline of December. So we reached out directly to Paso del Norte Foundation. We are looking to amend their budget to include a robust marketing campaign that not only emphasizes the fact that the funds are available, but that they are only available for a limited time. And so they're going to be spending a significant amount of dollars trying to get the word out to those folks. And so that's the plan for right now.
That's perfect, because I know we did a robust marketing for economic development, and I run into people really more often than I would like lately who are dealing with this and don't know their options, right? So even just educating that while evictions are going on, if you have been impacted by COVID, you are exempt from that. A lot of people just don't know the information, and so yeah, if we are having dollars that are left over and need to be spent very quickly, I think that would be a great thing to do so. So thank you for that. And then
Absolutely.
I don't know who for my next question is, maybe Carrie or just city manager. You know, the council is hearing a lot from the community about our libraries. I know that we've talked extensively about what our budget looked like this year and how, you know, staffing and things like reopening our facilities looks. But it also did come out in the news this year that the governor is sitting on about $5.6 billion in COVID relief. And so I don't know, and maybe actually this question is for the mayor, if Mayor, you had a conversation with the governor on how those dollars could really assist us as a community and our workforce. Because if we had the dollars to be able to open our facilities safely, I know that this council would support that.
If I may,
Sure.
Representative, if I could take a crack at it first. Mayor, are you okay, or did you want to respond first?
No, go ahead.
So, unfortunately, you know, the numbers like we reported today, the spike is up because of Labor Day. I mean, before Labor Day happened, the numbers looked really good. I mean, they were trending in the right direction. And I told staff, you know, we need to get ready to open up some of these services, in particular the areas that you're mentioning, including some of the rec centers and the different activities for the youth. But then the Labor Day happened, and told me, the staff told me, okay, we need to cool our jets and let's see what happens with Labor Day. I followed their advice. They were right. And then the numbers spiked. The numbers have spiked and have been spiking for quite some time. Today's numbers weren't as bad as numbers yesterday or the day before, but it's all relative, right? You know, you have to have a certain amount of time where you see a trend and a trajectory going in the right direction. So I think that what we need to do, I mean, some people are taking advantage of these bad numbers and using it against the council or our administration or our organization, and they're doing it incorrectly because, I mean, what's going on has everything to do with the pandemic. We've said this before, we'll say it again, that yes, we were impacted financially, so yeah, we did have to make some adjustments, but now we have the funding in place that we could start opening things back up to provide services for the rest of the year. So the funding is not necessarily the issue at this point. It's the pandemic, it's the COVID-19 and the numbers that we see here locally. That's what's driving it. So that's the answer. I mean, that's the answer.
Sure. No, and I absolutely agree, and I thank you for that information. It's good to know to be able to relay to people. But we do still have people that are furloughed, and if we had, the funding, and we could be having the conversation about bringing some of our workforce on in different capacities, right?
We do, ma'am, and you're right. And you're right about that, about the furlough. And the furlough has to do with the services not being provided and therefore not having those positions in place. I think the question becomes, to your point about having folks furloughed, is hiring people for not providing a service. Everyone who's on board right now is working. Everyone, either virtually, either physically, and or both. And so these areas where we did what we did had everything to do with the service not being provided, not necessarily 100% because of the money. I mean, we could have used reserves, we could have done a lot of different things, then that would have drawn down our reserves. We could have done we could have made a lot of bad financial decisions, but we didn't. You didn't. We recommended some tough decisions that the council approved. We're better off for it now. Those folks were all still connected to us. We're paying for their insurance for the rest of the year where they don't have that to pay for. I know that's not a lot, but that's something that we committed to doing because we're still connected to them. We still care about them. And that when we get back online, they still have a job here. And the reason why we're trying to protect them as much as we can is because of civil service laws or civil service rules. The laws, I guess, is local laws that we put in place at the council in the past and by charter has approved. So we want to make sure that we don't impact that, because I know there's been opportunities where we could have given them some money, but it would have then impacted their rights as they have them through civil service to come back on board and have the seniority that they have in those kinds of things.
I mean, again, I just think that if there were more CARES dollars coming in, we could be feeding more people. I mean, we can go back and forth on what we could be doing with the money, but we don't have it right now. So it's right here or there right now. But so my question just still is to the mayor is if there's been any communication or if we even know what he plans on doing with those dollars. And if those dollars also have a deadline of December 30th, that's something I don't know.
You're talking about the funding?
I've not talked to the governor about these dollars. I will tell you that the requests that I do know they're getting have to be from the communities that were less than 500,000 in population, because all of their funds flowed through the state before they were ever received. Mm-hmm. There's been a big movement afoot of all the cities below 500,000 to try to get more funding, but I don't know where we are at this time. I haven't heard anything and haven't asked of the governor's office about any of that. I know there's still movement in Congress right now to do more. The Treasury Secretary Munchin has said we need to do more. The head of the Fed has said we need to do more. And I understand that the House came out with a I want to say 2.3 trillion today offering, and it's going to the Senate, and we'll have to decide. But the biggest thing that we wanted as large cities over 500,000 was more flexibility on where we could spend it and a longer timeline to spend it, not being cut off by 12/30. So I don't know if any of that's going to be as a part of their budget or not, but we'll continue to monitor it. And if I get a chance to talk to the governor soon, I will inquire about that. But I just know that the majority of the requests for funding are coming from the cities below 500,000.
Okay, and I'll share the article with you so you have more information on it.
Okay, thanks. I want to thank everyone for this great presentation. Let's move on to our other items that we need to ratify.
Item number 3 is discussion and action on an emergency ordinance reenacting emergency ordinance number 019035, extending a disaster declaration due to a public health emergency.
Could I have a motion to approve?
Move to approve.
Second.
Okay, there's a motion and a second. Is there any need for further discussion? Let's vote.
Mayor, I just have one quick question for Mrs. Neiman, City Attorney Neiman. Are there any, I reviewed the backup documentation. I have not seen any changes, so my assumption is that nothing is going to change from the previous ordinance to the current one, correct?
Yes, that's correct. I covered that in the presentation. None of the three that you will be considering today are changing.
Thank you.
All right, let's vote.
There is a motion and a second to approve item number 3. On that motion, Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera. I see your
Make it
thumbs
easier,
up.
Jeff.
Yes. Okay, thank you. Lizarraga.
Aye.
Mayor, do you consent?
Yes.
And the motion passes unanimously. The next item is number 4. This is discussion and action on an emergency ordinance reenacting emergency ordinance number 019036 as reenacted and amended by emergency ordinances number 019062, 019068, 019081, and 019090. The penalty is provided in section 8.
Motion.
Motion to approve.
Second.
Let's vote.
There is a motion and a second to approve item number 4. Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera. You are thumbs up. Yes, aye. Lizarraga.
Aye.
Mayor, do you consent?
Yes, I do.
The motion passes unanimously. The next item is number 5. This is discussion and action on an emergency ordinance reenacting emergency ordinance number 019091. Penalty is provided in section 6.
Is there a motion?
Motion to approve.
Second.
Second.
Let's vote.
There is a motion and a second to approve item number 5. Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
Mayor, do you consent?
Yes, I do.
The motion passes unanimously. The next item is number 6. This is discussion and action on options to amend Title 10, Public Peace, Morals and Welfare, Chapter 10.20, Offenses by or against minors, to not criminally penalize minors for juvenile curfew violations.
Motion to approve.
Is there a second?
Second.
Okay, we have a presentation, don't we, Chief?
Yes, sir. We do. So, Mayor, Deputy Mayor Pro Tem Lizarraga, I know that you had asked some questions about this in the past, and there's others also that had other members of the council that asked some specific questions about it. The police department has gone back and done a lot of the research that was requested, and also have dug into the numbers, and I think they have it broken down by different areas of town, which I think will be very interesting for the members of the council to see those numbers as well, and that'll give you some more information for you to make recommendations on the policy direction you want on this. So, Chief Silva.
Okay, can you see my screen?
Yes, ma'am.
Yes. Thank you.
All right, so this is about the curfew ordinance. This is hopefully our final review. This ordinance has been in effect since 1991, and we come back every 3 years to discuss whether or not we're going to continue it. Just a quick recap, the ordinance currently does apply to a minor under 17 and or to their parent, and it is between the hours of 11 p.m. and 6 a.m. The curfew cost for a juvenile or a parent is $167. So what you all asked us to do, Representative Lizarraga asked for the raw data information, which we sent. Representative Schwartzbein asked us to review the top 10 largest city and the top 20 similar cities data to determine if they still continue to have a current ordinance. You've asked us to look at juvenile population data by region. We've also been asked to look into recidivism. You wanted to talk a little bit about the municipal court judicial process and then EPPD's final recommendation. So to start, these are the 10 largest cities, including El Paso, and only Austin has abolished their curfew in 2017. and I'll give you a few minutes just to look over the other cities. Wherever you see CFT, those are our cross-functional team cities, and we've also used those throughout the presentation. These are the 20 cities similar to El Paso, and out of these, only Albuquerque does not have a curfew ordinance. All the other cities of similar size to El Paso continue to have an ordinance in place. I'll give you a minute to look through it. And then we looked at the top 10 safest cities, which also includes El Paso as number 5. And of the top 10 safest cities, we all continue to have a curfew ordinance. Okay, so you asked us to look at the citations by region. So what you see in the center here is the population of juveniles between the ages of 10 to 17 by the region, and we use 2010 census data to come up with these numbers. And then here on the bar graphs, you'll see by region the number of population, and then this percentage is the percentage of citations they've received for that year. In 2014, for Hispanics, the Northeast was the most dominant area where citations were issued, but normally throughout the years from 2015 to 2019, Pebble Hills is the #1 region, followed by the Mission Valley. That's for Hispanics. For the white population, same population data. In 2014, the Northeast again was the #1, but generally it's Pebble Hills. That's the #1 area that citations are issued to the white population. And then when you look at the black population, it's the Northeast for almost all years except 2018, where Pebble Hills was higher. And just to recap, when we looked at the number of citations being issued by the ethnicity, it pretty much matches the population for El Paso, which is 80% Hispanic and 13% white and just under 4% for blacks. Again, just to recap, we looked at the juvenile citations on the yellow graph, and we compared it to the juvenile population by the regions. So it's right on target for Central, a little bit high for the Valley, slightly higher for Northeast, and pretty much on target for Pebble Hills and the West Side. And then our pie chart over here shows all citations for all areas, with Pebble Hills being the #1, followed by the Valley. Okay, so we're looking at recidivism on this chart, and what we found was very, very interesting. Almost 95% of the time, our curfew violators only violate one time per year, and they don't reoffend again. Multiple curfew violators only violate about 5% of the time. But when we do have a violator that has another charge, they amount to 35% of all violators. What's really important to know down here under other offenses, when we do have that secondary offense, it's either going to be alcohol and consumption or city park after hours. And these numbers hold true for almost all years except 2019, where things actually get a little bit better. As I mentioned before, we really start to have contact at the age of 13. And then by the age of 16, we're over 40% contact, where that's where our juveniles are having these curfew incidents. When we look at dispositions, and Judge Holguin will tell you a little bit more about it, in 2014, we had a high level, 52%, where people were self-admitting guilt. And then the secondary charges were that they ended up serving time, either because they didn't pay the fine or they didn't show up for court. Again, in 2015, it's going to be the same. 95% only violate one time a year, about 5% violate more than one time in the same year, and about that 35% are having that other secondary charge, which flip-flops between city park after hours and alcohol consumption by minor. Now, what changes under the disposition is that the guilty charges, guilty by admission, drop from that 50% all the way down to 41%. And then you start seeing the courts becoming more involved, and the dismiss defer cases start to rise, and they start at 16%. So that's very good. Again, 2016, no change, 95%, just under 5%, about that 35% with other charges. The charges of consumption of alcohol, city park after hours. The admission of guilt, again, is starting to go down, and the dismiss defer cases are coming up to 21%. 2017, about the same. The guilty charge, self-admitted guilt, is really dropping. We started at 52%, we're down to 28%, and the dismissed deferred cases are at a 24% high. 2018, the same, no real changes. However, in 2018, being found guilty by the judge does take a leap and goes up to 26%, and Judge Holguin will have to explain to you what's happening there, but the dismissed deferred cases are still rising, and they're at 20%. 2019 was our all-time low for all citations, and this is where we see that one-time curfew violators are now at 97%, which is higher than our normal 95%. The multiple curfew violators have dropped considerably, under 3%, and even the curfew violators with other charges drops 10% down to 24%. The bad thing is that the two major charges for other offenses are still alcohol consumption and City Park. But what we do see in the disposition of cases is that now the dismissed deferred cases are the highest. So just looking at all offenses altogether, again, it's that 95% for one-time violators, that 5% for multiple curfew violators, and around that 35% mark for violators with other charge. And then you can see that alcohol consumption and City Park are both number one as the primary other offense. And then the dispositions based on all years, self-admitted guilt is going to be the highest, but the dismissed deferred cases by the judge are at 18%. So we also looked at curfew violators over multiple years, and the numbers are very, very low. We've only had less than 5% violate in 2 separate years, less than 1% violate in 3 separate years, and only 116 violated multiple times within the same year, and that's less than 5%. So there was we'll talk to you.
Oh, you got cut off, Chief. We couldn't hear your last
We couldn't hear your
comments.
last part.
Hold on.
Come on now, Chief.
It's not me. Can you hear me? Yes?
Oh, we know it's not you. They just missed the last slide, I think.
Okay, let me see what the last slide was. This one?
Start there, even if you already did it that way.
Okay, so what I was saying here is that we looked at violators over the years, and these are multiple violators that have violated multiple times within the same year, and the violators are very low. We've had less than 5% violate in 2 separate years, and less than 1% violate in 3 separate years. And over multiple years, we've only had 116 from 2014 to 2019 that have had multiple violations over the same year, less than 5%. So I want to turn it over to Judge Enrique Holguin, who will talk to you a little bit about the municipal court judicial process. If he can get online.
Yes. Hi. Hello. Good evening, Mr. Mayor, City Council. My name is Enrique Holguin. I'm a associate municipal judge, and I have been for a little over 5 years now. I'm actually here in a pinch-hitting capacity for the presiding judge of court number 1, which is Judge Michelle Morales. And just to give you a quick overview of the processes for the juvenile citations, I want you all to know that it's all one specific court, it's Judge Morales. Both the parents and the juveniles are notified. Now, at the hearing really is meant, this whole process is meant to be positive intervention for the juveniles. At the hearing, there is a determination if they want to participate in teen court. Now, teen court is an awesome program that Judge Morales has spearheaded. I'm not going to do it justice, but, explaining it, but pretty much it's for them to see the court processes and, again, to have that positive interaction with court, with officers. They have mock trials. They play judge, jury, a bailiff, prosecutor, the whole deal. And again, it's to have that positive intervention with these juveniles. And like Chief said, the deferral status, a lot of these cases are put on deferral. They're on teen court. They're found not guilty. The numbers that I was given this evening from September 2018, about 87% of these cases are dismissed. And again, that just reiterates that it's not trying to be any kind of harassment policy. It really is to give that positive structure to juveniles. Now, one thing that I want to stress very much is officer discretion. You know, an argument that I had heard from colleagues and friends of mine is, well, what if my daughter's at a quinceañera? And that's perfectly understandable. But an officer and anybody, it's common sense. We know when somebody's up to no good versus, you know, after a football game, they're putting away band equipment. You know, they're at a pizza party and so forth. Again, the quinceañera example. They're not going to be cited. They shouldn't be cited. That is officer's discretion. Of course, the totality of the circumstances. And I just, of course, my job is to enforce the ordinances, whether it stays on as ordinance or whether it doesn't. Obviously, I will abide by that. But I just see the positiveness in it. It's a positive tool for the community. Like Chief said, one thing we have in common as a top 10 safe city is we all have a curfew. We all have a curfew ordinance. And just as somebody who's a practicing defense attorney who handles juvenile cases, as a former at-risk youth who, you know, and perhaps I'm oversharing, was arrested at 14, as a father of 4, and lastly, as a municipal judge, I definitely see the benefit of this curfew ordinance. And I'm here if anybody wants to ask me a question. I'm glad to be here.
Okay, if you don't have any questions, I'll continue on. Thank you, Judge. I appreciate you chiming in.
Chief, Representative Rivera has a question.
Yes, sir. Go ahead.
Henry, do you have a question?
I didn't hear the question, Mr. Mayor. Okay. Sorry.
Here it is. Regarding the courts, do you see a percentage? What was that percentage that you defer? And it's not all necessarily a fine, correct? There's also the opportunity of community service, and like you said, the teen court, which is judgmented by their peers, and they abide by those rules, correct?
Yes, sir. And I don't have the specifics. I guess because the glare, not the glaring, like the glowing number, I should say, it's that 87% of those cases are dismissed. Deferral status, because I also preside over, you know, traffic dockets or any other kind of dockets. Deferral would be like, okay, so this young man or young woman or man is told to do community service, not to refrain from being caught in this similar situation. If he or she complies, the case is dismissed. I don't have specifics how many are placed on deferral specifically, but that is a big component of how we adjudicate these citations.
And just to add to that, the parents are not fined. When the juvenile is not fined, neither are the parents, correctly? They're just admonished verbally to say, hey, take care of your kid.
That is correct, sir. That is correct.
Thank you.
Now the 13, and just to touch base real quick on the 13%. In that 13%, a lot of times the juveniles and the parents collectively, they just plead guilty themselves. They think, you know what, I don't have the time. I don't want to proceed in the deferral process. I don't want to take part in the teen court. I'd rather just pay the fine to be done with it. And also the other part of that 13% is the judge, based on his or her discretion, fines a juvenile, delinquent for having been out past curfew.
And you find that that 13% doesn't return, or a first-time offender doesn't return. You also have a high percentage of that.
The recidivism that they offend again.
Yes, correct.
And like Chief had mentioned, that an awesome stat is that 95% of them only violate that one time. And we think that's great. We want to obviously keep that and make that go north if we could, northward.
Thank you very much, Judge. Appreciate it.
Thank you.
Mayor?
Yes, Tommy.
I'd like to interject with just one quick point. Number one, I want to commend the judge. I asked Dion, I texted her, did I hear that correctly, that he had run into some problems when he was younger? And she said, yeah.
Yes.
And so I wanted to say that before I brought that up, but I only mentioned that because I want to commend him for sharing that with the council. And then he's doing pretty good. And there's a lot of young people that make a mistake, and that's all it is. And I think that's what I was hearing from the council. And, we're concerned just like you are. I mean, I've got boys that are in college now, and you don't want them to make one dumb mistake and then be tarnished the rest of their lives. And the recidivism rate that Chief Silva shared with me, I thought that was a phenomenal statistic. And if we're able to have something in place that kind of taps the young person on the shoulder and says, hey, you need to straighten up. And then we have programs in place, and we have good people like Judge Olguin and others that, you know, they were there at one point themselves. And as you can see from what he's shared with y'all, they have been very fair. I would say they've been extremely lenient in working with the families in order, and I don't mean that as a knock, Judge Olguin, I saw you smile. I meant that just as a, I mean, I think we want our young to succeed. Our youth to succeed, and I think that's what you're about, and I think that's what the other judges are about, and we support that. I support that, and I want to see our young people succeed in El Paso, to go out and do great things. So I think that the recidivism rate is a phenomenal statistic. I mean, when Chief Silva again shared that with me, I thought that was a great indicator of success of the program. So I just wanted to add that, Mayor. Thank you for allowing me to share that.
Before I give up to my first one, Mayor, I'd like to ask the judge something else so that he can explain to the others that don't understand this, is that this will not follow the juvenile for the rest of his life, correct? It's how shall we say, we used to say, the book is closed once he turns into an adult, or she turns into an adult, correct? And there will be no record whatsoever of any citation, of any or any community service, anything like that, correct, Judge?
That is correct, sir. The only thing I can touch on is I was a former prosecutor before I went defense attorney, and the only and I can explain to that as personal experience, being 14, being down, being arrested, going through the system. My parents, the point of strangling me, I went through the whole gamut. So it is confidential. The only ones that will be able to see it would be, of course, law enforcement agency. When I was a prosecutor, if somebody fell on my docket who had a DWI, had an assault charge, I could see that he or she was cited for, a juvenile in possession of alcohol, or possession of marijuana, or a curfew violation. But that, to my understanding, and I've lived it personally, when I was applying to law school, I had to get everything, and I went to the juvenile court system, and I got a letter saying that no record exists.
Right.
So aside from law enforcement agencies, nobody else should be able to access that.
Correct. And then when we were enforcing it, I believe it was stated that it would take an act of Congress for anybody else to get into, see a juvenile file, correct?
That is correct. Yes, sir.
Representative Rivera, this is Lilia World from the Municipal Court. I just want to echo that we do provide driving records to whoever requests them, but juvenile records are sealed. So anything related to something that happened as a juvenile, they will be removed, completely removed, not even redacted, they're completely sealed. Except for law enforcement, of course, the parent and the juvenile himself.
And okay, thank you very much, ma'am. Thank you, sir. Thank you, Judge.
Thank you, Representative Rivera. Thank you, sir.
Okay, moving along. So what I understood as city
Chief, Representative Anello has a question, and then Representative Hernandez. The mayor just dropped off, but he did tell me that was the order.
Okay.
I'll wait to the end of the presentation.
You want to wait till the end? Anybody else want to ask questions?
I'll go right now because I have a question for the judge. I'm sorry, Chief. I know you're not done yet.
No problem.
But first, I want to say that this is already really great information. I think this is kind of the data that we really needed, so I appreciate it and look forward to the rest of the presentation. My question for the judge is, so totally understand the information about deferred or dismissed cases, but my concern, and one of my concerns that I brought up when we first had the conversation, is the fine. Do you know the percentage of times that someone is fined and someone is given community service?
You know what, and Representative Vanilla, I wouldn't know the specific numbers. I know I have some of my representatives in municipal that can help me with specifics to that, because I just focus on that 13%, and that 13% is, find them guilty, they plead guilty. As far as, I guess, specifics to the amount and how often, is that what you're asking?
No, I guess what I'm saying is to those who plead guilty, do they still have the option for community service?
Oh, yes. And Ms. Worrell, correct me if I'm wrong, but they do have the option for community service. I can grant that
as an alternative to paying the fine.
Yes, that's exactly right.
And what happened? Oh, I'm so sorry. Go ahead.
Sometimes when they are put on deferral, part of the deferral sentence is that they must complete community service. And then after they complete it, then the citation is dismissed.
And what happens if someone can't pay the fine?
Well, then at that point, if they can't pay the fine, the community service is a great catch-all. I mean, that is how they would pay it. They would pay it through hours that I can, at my discretion, assign to them.
Okay.
We also, the court also offers a 6-month payment plan too. And they are also, the parents or the juvenile can come in and request an extension.
Okay. Because, yeah, I mean, one of my concerns is that for some people, this is a lot of money, you know, and I wanted to make sure that they had, they're given the option, you know, that they have an alternate means to deal with this. So, okay, thank you all.
Thank you.
Okie dokie. Any other questions? I'm almost done. Okay. So what I understood City Council's concern was what you just talked about, the economic impact on the family, especially if the juvenile and the parent both get a citation. You were concerned about creating a juvenile record, on that record following them through college or potential employment opportunities. You talked about the emotional impact that getting a citation would have on the family, and also just navigating the judicial process and what that entails. Just to reiterate what we talked about, confidential records related to the conviction or deferral of a disposition for a child may never be disclosed to the public. So the only people that are entitled to that court record is the judge or the judge's staff, a criminal justice agency like PD, the Department of Public Safety, DPS, the attorney for the party in the proceeding, the child himself, or the child's parent. So just to reiterate what we talked about on who could have access to those records are sealed. So I looked at a couple of other curfew ordinances from other cities, and I noticed that San Antonio can issue a warning or a citation to the parent or guardian of the child. And I looked at Dallas, and Dallas says they can issue a warning, and if the minor was previously contacted in a violation, then the officer could issue a citation. So PD's recommendation, you know, based on best practices, being a forward-thinking department, you know, looking at things about police reform and what's best for the community, and taking into account all the things that City Council was concerned about, what we suggest is that a peace officer can issue a written warning notice to the parent or guardian, and we would document that warning notice in a police report, and only upon the second violation within the same calendar year would we issue a citation, and that citation would only be issued to the parent or the guardian. So that's the recommendation that we have. We explained to you the recidivism. We talked to you about all the citations, where they were issued, who, which racial ethnicities they were issued to, and this is our recommendation to council. And with that, I'll take any questions.
I think that'll be my cue to go, if that's okay with everyone else. Thank you, Chief Silva, for this information. I think that this is answered and has given me a lot of relief to look at that recidivism rate. I just want to clarify on the recidivism, Chief Silva. Is the definition of that looking at repeat offenders for additional curfew violations, or is this in the lifetime of that youth as they become adults and looking at other misdemeanors and potential assaults, etc.?
So when we looked at the information that I shared with you, it was only between the years 2014 and 2019, and as I explained to you, generally 95% of the time they only violate one time. 35% they will have other charges, but we only track them, the same individuals, from 2014 to 2019. And I think we showed that over the life of those citations, that they started to come down in 2019. It was our lowest citation year ever, only issuing 320 for the whole city. So I think we're showing that just the violation itself, juveniles are not really committing that violation.
Oh, okay. So that answers my question. And I think that this is a good first step so that we can start to identify the curfew ordinance over multiple years, over the lifespan and of our youth as they become young adults. And yeah, of course, I've never received a curfew violation, but I can tell you I've received a lot of warnings that has given me that scare tactic to go on a better path. So kudos to you, Judge Holguin, for sharing your story with us. But I just really want to re-emphasize the point that our youth who go into because they're under the age of 17, their documents are sealed unless they're applying for Secret Service, or if they're a Secret Service status, or if they're going into law enforcement. But for purposes of employment, at the time that they are a minor, let's say they're 16 applying for employment, will they see that infraction on the record at 16?
No, they don't have to. That won't show. As Ms. Worrell mentioned to you, the only person that they're going to release that information to is just a juvenile themselves or their parent, or as I mentioned, an attorney or a law enforcement agency, but an employer cannot get that information. The juvenile can give it to them themselves if they choose to, but it won't be released by municipal court.
Okay. So I don't have any other questions. I feel very comfortable with the data that you presented today. I think my area that I represent is the Pebble Hill Regional Command Center. So I think that as I'm, going within the neighborhood, I think it's clear that there's a support in the community for the program. I think that what I would like to see in terms of policy looking forward to the next 10, 20 years is that we track recidivism as a youth, from a youth into adulthood, and then looking at their standing in the community, whether it's positive or negative, or back in incarceration rates. And so I just wanted to share that with you, and so that we can look at policy and the data that we're collecting for the future. I think this is a good first step to doing that. But thank you, Chief Silva, for the hard work. I can tell you that there was a lot of research put into that. So it doesn't go without saying that you did a wonderful job. And so we appreciate you being so responsive to council. Thank you.
I appreciate that.
Okay, I got cut off for a while, so I'm assuming we've done Representative Vanello, Representative Hernandez. Representative Rivera had a question, and also Representative Lizarraga. So, Henry, did you want to go?
Yes, sir. I just want one with the chief, a couple of questions there. Thank you, Chief. That was an excellent presentation that you just presented to the council. And your recommendations then is to keep it as is, if I understood you right, amending it to give the police the authority to give them warning, correct?
Yes, we, trying to be forward thinking and making sure that we don't have all those negative impacts to the community that you all reached out to me and talked about. The recommendation is that we issue a warning to a first-time violator. We still bring the child home, and we issue the warning to the parent. We're not going to issue the warning to the juvenile. So the family's involved early on. We can offer them some of the other programs that we have and explain to them, like, the Explorer program and some of the other things that are going on to kind of keep them off the streets at night, and also explain that generally some of the other charges that they get involved in is the city park after hours and the alcohol consumption. We don't want them drunk driving, things like that. So we want to offer them other areas that they can move into. But during the second violation, if they reoffend, then we would issue a citation, but only to the parent. But what I also included is that only within the same calendar year. So that means that if somebody offends when they're 13 and they don't offend again till they're 15, they're not going to be penalized. Right. We want to make sure that they're not repeating the same offense in the same time frame. We don't want to keep punishing them over the course of their lifetime, right? Oh, 2 years ago we stopped you, we're going to fine you again. We don't want to do that. Yeah. So we only want to fine those that are reoffending within the same calendar year, but we do want to give that written warning to a first-time violator.
And having been there and having seen this, officers do how should I say, use their discretion, and there's a percentage, a double-digit percentage, where neither the parents nor the child is cited, but although, like you said earlier, they are taken home because they can't be left outside, correct?
That's true, but the problem with that, Mr. Rivera, is that when you ask us to do
I
source
understand.
information and you want us to do data analysis,
Right.
you can't capture that data.
Right.
That's why the written warning is so important, because that will tell us how many times we're having contact with that juvenile and their family.
Right. Again, it usually was a repeat juvenile that was out caught in the curfew or runaway. But what I'm trying to say is the officers do use their discretion, and most of the time they don't issue citations because they understand that the youth was putting away banned equipment or coming home from a football game,
Right, and we talked about all the different areas that are already a defense to prosecution, coming home from employment, coming home from a school event, if you're out with your parent, if you had an emergency, your car broke down, all those things are already in the policy.
So great, and I agree with you, and all I'm saying is that this program really isn't meant to target juveniles or any kind of racism, but it's there to protect and to minimize the juveniles from any harm, any crime, and most of all participating in any major crime. Correct? And you defer them in that way, and that's it has a positive effect.
It's to reduce the opportunity for them to engage in any type of criminal activity and to become a victim.
Again, thank you, Judge. Thank you, Chief. I just made you a judge.
I appreciate that.
And, okay, thank you, Chief. Appreciate it. Great program. Thank you.
Okay,
and great presentation.
Okay, Representative Anello and then Representative Lozarga.
Representative Anello already spoke, Mayor.
Oh, she told me she hadn't had her. She just texted me. Never mind. All right, Representative Lozarga.
Thank you, Mayor. Chief Silva, I just really want to thank you for all your hard work. You know, we challenged you to come back with all this information, and I know it was a lot of work for you and for your department, and I appreciate you hearing our concerns and for coming back. I have a question about with the proposed change. Would it mean that the curfew violations would no longer be able to be heard in teen court since the citation is going to be given to the parent or guardian, or what would happen?
That would be something municipal court would have to answer, because now that we're not issuing the citation to the juvenile, it wouldn't meet the needs of them attending teen court. So it would just be the adult going to the court process.
Yes, this is Lily again. Chief Silva is correct. Since the juvenile is not cited, the ticket could not be referred to teen court.
Okay.
So we would be reducing that impact to the program. But again, we were trying to find a really good balance between not issuing that citation to the juvenile, but still leaving the parent as ultimately responsible.
Correct. Thank you, Chief Silva, so much. And Dion, thank you as well.
Can I just quickly thank my team? They worked so hard, Officer Felipe Barrera and Ms. Sultani Riley and Mr. Castaneda, Officer Castaneda, and their Lieutenant Peralta. They helped me so much on this. It's not a one-man job. I mean, it takes a whole team to put together a project like this. So I wanted to thank my whole planning team for helping me.
Thank you, Chief.
Yeah, thank you, Chief. Are we ready to? Have we made a motion on this, Laura?
There was a motion and a second, but I'm not sure what action council wanted to take on it.
Is that with the amendment, Ms. Prime?
It was the recommendation.
The recommendation on the warrant? Do we have to amend that?
So Mayor, this is Carla. There's currently no proposed amendment. So what you did was make a recommendation. If council so chooses to direct the PD to come back, that would be brought back to the council with those.
I think,
I'm sorry, ma'am, you broke.
Mayor, I think that one of the points that we made in the previous presentation was that we didn't just want to make changes for the sake of change, and that's the reason why we looked at whenever we assigned this out on the staff standpoint, after the council gave guidance, I wanted to make sure that it was compared to the top 10, top 20 cities and who had a curfew, who didn't. And as it was pointed out, only one city didn't have a curfew. And then the other thing I asked them to look at, to bring back, I thought it'd be important for council to see, is the recidivism rate. And then the last thing was the percentages, so that when they go through a process with us on the staff side, and when they presented that to us, one of the questions that I asked was that they look at the not only recidivism but also look at the makeup of who gets pulled over or who gets the citation or the warning, and break it out by race. Since that's an issue, and even if it wasn't an issue, I still wanted to know. And so that's the reason why the way it was presented today, I think it gave you everything you needed to know. I don't think that the council had indicated that they'd make any changes, and I don't think that any changes are required based on what we presented, unless the council thinks otherwise. But from a operational standpoint, I think it's achieving the objectives that you would want to achieve as a community in terms of the numbers. I mean, the numbers speak for themselves. The fact that the recidivism rate is at 95%, they only offend once, that's a very impressive statistic.
And it was my motion to accept Chief Silva's recommendation.
Do you need a second still?
Second.
Yes.
Do we still need a second? Second.
I think Representative Hernandez has a question.
Right, and so the recommendation, I'm just curious if the ordinance says that citations for warnings are currently issued, if that's not a practice, if that needs to be amendment as part of the adoption of this ordinance. Is that true?
No.
Can you say the question again? I apologize.
Yes, so the ordinance, because I don't have the ordinance as is, I only have the ordinance number and the whereases to re-adopt the ordinance for the curfew. But in the existing ordinance, does it preclude officers from issuing warnings in lieu of citation?
No, it's not written in the current ordinance, but we can always issue a written warning. It doesn't necessarily need to be added into the ordinance. What needs to be determined is whether the citation is issued. So if we can make a policy and say that we'll issue warnings on the first round, we can do that as a policy.
Well, I think that before we throw that out, I mean, I think that what the numbers have demonstrated is that there is discretion utilized based on the severity of the issue, and I think that it shows that the majority of them are warnings, and that the judges work with the violator, and that they're very lenient in the way they deal with the issue. So I would say that it's working right now. I think to give instructive direction, so much so that it's so autocratic that they have no discretion, I think would be a mistake. Because, I mean, unless the program wasn't working. So that would be...
I was just curious. I agree with you, Mr. Gonzalez. I just wasn't sure if there was prohibitions for like using discretion and warnings that's drafted in the ordinance, because I just don't have it in front of me. But I'm comfortable with that, and I think that so long as officers are using that discretion and are not prohibited to and are encouraged to, then I think that should be the standard in practice moving forward.
Yes, ma'am.
Yeah.
And then just to reiterate what the city manager is saying, you never want to take the discretion from our officers to issue warnings, and that's something that they should always have. So if that's the case, then I don't recommend making an amendment.
And are we keeping it then as it is, as Representative Hernandez mentioned?
That would be our recommendation based on the statistics that were presented to the council. Again, if there were issues or if there were problems in it and the council or us as a staff, I mean, if there were issues, we would point it out and say, hey, these are some concerns. And so we were going to make adjustments. We would need to be told, and we'd come back and recommend that we recommend some adjustments. But because of the numbers being as impressive as they are, we would say that it's working. Let's keep it going in the same direction. I think we have a very good court system with the judges working with the I don't want to call them offenders, violators, and they're working with them. And so I think it's working right now. If it wasn't, I think that we would recommend a change, and I think council would see on its face that would need to be changed. But right now, we believe it's working, so we do not recommend any changes.
Okay, so there's no action to be taken on this. Let's thank you, Chief. That's a very good presentation, very good data. Let's have a motion to move into executive session.
Motion to move to executive session.
Second.
There's a motion and a second to return to executive session. All in favor?
Aye.
Aye.
Anyone opposed? And the City Council of the City of El Paso may retire into executive session pursuant to Section 3.5A of the El Paso City Charter and the Texas Government Code, Chapter 551, Subchapter D, to discuss any of the following: executive session item 1, application of El Paso Electric Company to amend its distribution cost recovery factor under the city's original jurisdiction, and Public Utility Commission of Texas, docket number 51348, matter number 20-1008-155, under 551.071 and 551.087. Executive session item 2, AT&T Communications Interstate Division Special Privileged Debt, matter number 17-1044-795 under 551.071. Executive session item 3, acquisition of real property located on Far East El Paso under 551.071, 551.072. And executive session item 4, economic incentives for a warehouse distribution company to be located in the city of El Paso, matter number 19-1007-2515, 20-1003-1083 under 551.072, 551.071, 551.087. These matters are taken into executive session under 551.071, consultation with attorney, 551.072, deliberation regarding real property, and 551.087, deliberation regarding economic development negotiations. It is 6:33 p.m. Council, I'll be calling you in shortly.
IT.
I'm in.
Thank you, Mayor. We're getting everybody else in. I'm calling Rep. Rodriguez. She's the only one that I believe is missing.
She told me her
Okay, she's on now.
iPad. Okay.
May we have a motion to come out of executive session?
Motion to come out?
Second.
Second.
There's a motion and a second to come out of executive session. All in favor?
Aye.
Yes.
Anyone opposed? The work session is back in session at 8:17 p.m. Mayor Pro Tem Lizarraga, do you have a motion on EX1?
Yes. Motion, September 28, 2020, that the City of El Paso authorizes the city attorney to file a motion to intervene in the Public Utility Commission of Texas, docket number 51348, application of El Paso Electric Company for a distribution cost recovery factor. This motion is intended to grant broad authority to the city attorney to take any action necessary to address these matters in consultation with the city manager. This also authorizes the city attorney to retain outside counsel and any other necessary
Froze.
You froze. Sis, you froze.
Can Ms. Prine read the motions?
Let me.
Can you read it?
Yes, let me pull it up. Motion made by alternate Mayor Pro Tem Lizarraga that the city attorney in consultation with the city manager, wait, I'm sorry, that's EX2. I don't have the one for EX1, I'm sorry.
I can read it, Laura.
Thank you, Carla.
You want me to start all over, or you want me to just read the second part? This motion is intended to grant broad authority to the city attorney to make any action necessary to address these matters in consultation with the city manager. This authorization also authorizes the city attorney to retain outside counsel and any other necessary consultants in connection with this matter approved this 20th day of September 2020.
Motion to approve.
Second.
Okay, let's vote.
There is a motion and a second on executive session item 1. On that motion, Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Okay.
Salcido.
Sorry.
Okay. No problem. I see you now.
Okay.
Right now. Okay. Thank you.
Salcido.
Bye-bye.
Aye.
Rodriguez. Rodriguez? Rivera?
Yes.
Lizarraga?
Aye.
Rodriguez? I believe her camera froze. Rep. Rodriguez,
Okay.
can you hear me?
Let's move on.
Okay. In the voting session, the motion passes. Representative Rodriguez not present. Executive session item 2.
Yes, motion, September 28, 2020. Motion made, seconded, and carried that the attorney, in consultation with the city manager or his designee, be authorized settlement authority to negotiate a settlement and resolve the city of El Paso's claim against AT&T Texas regarding the payment delinquency of several special privilege licenses granted by the city. The city attorney, in consultation with the city manager or his designee, is authorized to negotiate a settlement agreement and sign all necessary documents to effectuate this authority under matter number 17-1044-795 as recommended by the city attorney.
Is there a second?
Second.
Okay, let's vote.
There is a motion and a second on executive session item 2. Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
My camera froze. I don't know what item we're on.
We're on executive session item 2, ma'am.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
And the motion passes unanimously. May we have a motion to adjourn?
Motion to adjourn.
Second.
There's a motion and a second to adjourn the work session. All in favor?
Aye.
Aye.
Anyone opposed? And the work session for Monday, September 28th, 2020 is adjourned at 8:23 p.m. Council, thank you for your patience.
You're welcome.
Thank you. Good night.
Thank you, Laura.
Bye.
Good night.
Good dreams.
Thank you. Bye, everyone.